Okay. Good morning to our speakers and distinguished guests from the government, civil society organizations, medical societies, pharmaceutical industry and associations, and other stakeholders from the health sector. I am Joyce Reyes. I am the Communications and Advocacy Director of the Strat-Based Institute, and I will also be your host and moderator for today. Welcome to the roundtable discussion From Awareness to Action, Empowering Stakeholders for Better Liver Care. Now, this event is organized by the Strat-Based Institute in partnership with Yellow Warrior Society Philippines and the Universal Healthcare Watch. This is also a hybrid event, so maraming salamat po sa lahat ng kasama natin ngayon dito sa venue. And thank you very much as well to everyone who is watching us live via Zoom and also is monitoring. I think we are also live on Facebook today. As we know, January marks the annual observance of Liver Cancer and Viral Hepatitis Awareness Prevention Month in the Philippines. Liver is a vital organ responsible for crucial functions in our body. It plays a central role in detoxification, metabolism, and the production of essential proteins. The liver is a resilient organ, but it is not invincible. In the Philippines in 2020, liver diseases accounted for 27.3 cases per 1,000 deaths and recorded a total of 10,594 new cases. Sabi nga natin, that's one too many, no? Every life counts kasi talaga. And these numbers may not even reflect the true burden of liver disease in the country and may likely be underestimated due to limited epidemiological studies. Now, this is why this forum gathered key stakeholders to promote awareness and to discuss the continuing challenges faced by patients living with viral hepatitis and liver cancer, particularly how discrimination against them can be addressed by collaborative efforts between the government, the private sector, civil society, and society as a whole. So to begin our event this morning, it is only fitting to acknowledge the efforts of our partner organizer, the Yellow Warrior Society Philippines. The Yellow Warrior Society Philippines is a national organization comprised of individuals who have not only battled against viral hepatitis, but have become warriors in the fight for the eradication of this disease. Their commitment to raising awareness and advocating for patient rights has positioned them as a beacon of hope for countless individuals. So to formally open our event, let us welcome Mr. Hilario Pahak, President of the Yellow Warrior Society Philippines.
Good morning po sa lahat. Thank you, ma'am. Medyo ninenervyos ako dito. Good morning, partners, distinguished guests, and members of the Yellow Warriors Society of the Philippines. 13 years ago, a group of professionals came together to form a group. All of them graduated from college, looking forward to get a good paying job and give back to their families. Unfortunately, all of them was tested positive of hepatitis B during that time. Only international companies and international manpower agencies test for hepatitis B. Because of the discrimination that they experienced, they created Yellow Warriors Society Philippines. Their priority was getting lawmakers pass in an anti-discrimination bill. Access to treatment was just secondary. Placing food on the table is much more important. Their own health which undesirable. Most of our activities together with the Hepatology Society Philippines is toward awareness, believing that if we get all sectors educated on that hepatitis B, discrimination will stop. Unfortunately, the opposite happened. More and more employers started to screen for hepatitis B. Perhaps they did not understand our message. This was no different from what was happening in other parts of our, especially in the Asian Pacific. Coalition were formed globally and regionality, but pushing for policy change is not easy, it seems. In terms of treatment, we started with injectables, then tablets, and as years pass by, antiviral treatment become more effective and suppressing and viral load. When I look back on our past that officers we accomplished together with our partners, I can say that all the things we have done has gained transaction and produced result. So what we have achieved in the past decade? Number one, DOLE Department Advisory Number 5 Series of 2010, which is guideline for implementations of workplace policy and program on hepatitis B. Winning a court case versus restaurant, making it is first hepatitis B landmark case in the Philippines. Clinical practices guidelines is already finished, which is actually one of the major hurdles of other patient group. Globally, viral hepatitis was placed in the SDG 3.3. Simplified guidelines for hepatitis B treatment will come out soon. Ability in generic antiviral treatment. Implementations of viral hepatitis program is selected pilot sites which started in 2019. This milestone would not been achieved without all working together, and when thank you for contributing to this achievement. This is why I invited you all again today. We want to ask you for help to be able to address our concern. One, we ask for help be able to convince legislation to pass and anti-discrimination bill, while the DOLE advisory is a tool to protect employee from getting fired from work. It is very difficult as an applicant not to be denied of work since HR. Manager can take a lot's reason, reject the applicant. That is why we can screening to be breathed in the workplace setting, while the price of diagnosis yet get down and the cost of treatment has become affordable. If we have work, we can not to go to a government facility, those understanding our healthcare system. We want to be produced members of the society, and we have our own goals and aspiration as well every time we get rejected from work. Medyo mahabang binabasa ko, pasensya na po kayo. Second is there will continuous expansion at the viral hepatitis program. It has been 3 years, and I believe we have to learn from down facilities, social hygienes, clinic, and LGU. He was implement the program. They has owned their ability to run the program despite of having challenge. Lastly, liver cancer is the fourth most common type cancer and second most common cause of cancer deaths in the Philippines. Just its moon had 2 members who have passed away, although not sure which caused their liver cancer. We can realize that we cannot other than anything to do, and only of age 30 to 40 years old, none will do not how. Many young people and here just waiting by pass. Life is short. Ang buhay ay maikli. Alam naman natin po yan. So dapat kinakailangan tayo bilang miyembro ng Yellow Warrior Society of Philippines, ibang grupo, ay patuloy nating ipaglabang ang advokasya ng bawat isa sa atin. When you don't have resource every time, we have somebody who is young and has liver cancer, make us fear our lives because we know in case we get family, will assilled. That out-of-pocket cost of liver cancer treatment is a burden a middle-class family and much more those less privileged. This will surely affect and finance of each member of the family. Their lifestyle will change and will create a distress to the family. Relationship can be affected and difficult decisions must be made. We have to work together in creating a liver cancer, support a program for patients. No one should be left behind the cancer. Invention should be integrated in UHC benefits package in the National Nutrition Council government website and started in 2014 liver cancer claim the lives of 20 Filipinos a day, numbers projected and doubly by 2030. We have prioritized preventing liver cancer and increasing hepatitis vaccination coverage, expanding services for hepatitis B and C treatment and educate people in lifetime disease. At the same time, we should protect liver cancer from financial hardship. Together, we can improve patient access to care, improved health to outcome. Kaya magandang umaga po muli sa inyo, pagpalain po tayong lahat.
Thank you very much for that insightful opening remarks, Mr. Hilario Pahak. Let's give him another round of applause, please. All right. Medyo nakakalungkot yung kinukwento ni Mr. Hilario Pahak kanina. But seeing everyone here, participants from different sectors of society, all willing to help, collaborate to address liver illnesses, problems, challenges we are facing, it gives us hope, diba? Na merong, there's a better future for all of us. So thank you again for joining us today in this event. Now, we are also honored to receive a recorded message of support from the Department of Health, represented by Undersecretary Lilibeth David. Yusek David is the Chief of Staff and Undersecretary for the UHC Policy and Strategy Cluster of the Department of Health. She oversees crucial developments in our local health systems, as well as in the planning of our country's health policies. So let us all listen to the recorded message prepared by Yusek Lilibeth David. Okay, so I was just informed that, Okay, so instead of the recorded message, I think nagpadala na lang ang nagpadala ang DOH ng representative ni Yusek David, and the representative will be joining us later in the panel discussion. So abangan natin yan mamaya when we do the panel discussion. And then we move on now to our keynote speaker. Our keynote speaker is Senator Nancy Binay. She is a member of the Senate Committee on Health and has consistently expressed her support for legislation against discrimination. Now, unfortunately, due to some unforeseen circumstances, she won't be able to join us today. But she sent us a special message she also sent us a special message. And to read that message, we have with us from the office of Senator Nancy Binay, Ms. Carlene Yap Villa.
Thank you, Ms. Joyce. Magandang umaga po sa lahat. Una, maraming salamat sa Strat-based ADR Institute, sa Yellow Warrior Society of the Philippines, at sa UHC Watch sa pag-imbita sa akin sa pagpapasinayan ng Liver Cancer and Viral Hepatitis Awareness Prevention Month. Second, I want to apologize for missing today's event in person. Yet I am very much compelled to share with you an important topic that affects millions of people globally, and it's essential for us to understand its impact and work together to make a difference. 1. Global impact of viral hepatitis. Approximately 300 million people worldwide are living with viral hepatitis, mainly hepatitis B. This puts them at a higher risk of developing a serious condition, liver cancer. 2. cost-effective solutions and existing gaps. There are effective ways to address viral hepatitis, proven to be cost-effective. However, significant gaps still exist in diagnosing and treating hepatitis infections. 3. Political commitment for a healthier future. To tackle viral hepatitis effectively, there must be a stronger commitment from our leaders. Advances in public health approaches are crucial for prevention and treatment. 4. Quality care for all. Achieving our health goals require better access to high-quality infection management. Public, private, and non-governmental providers should collaborate, connecting efforts with sexual and reproductive health, family planning, and adolescent health services. 5. Urgent need for political support and funding. Sexually transmitted infections, including viral hepatitis, need urgent political commitment and funding. This helps increase access to health care and medical treatment, countering the rising incidence of these diseases. 6. Ending discrimination. Shockingly, Filipinos with viral hepatitis face discrimination at work. Discrimination has no place in our society. Everyone deserves equal opportunities and respect, regardless of their health conditions. 7. Rights and equality. Prohibiting people with hepatitis B and C from jobs has no scientific or legal basis. Employment discrimination based on hepatitis B positivity denies basic human and civil rights. Everyone should have their chance to contribute to society. 8. Supporting public health initiatives. Currently, screening, diagnosis, and treatment for hepatitis B are concentrated in the private sector. It's crucial to support initiatives within the Department of Health, collaborating with various agencies and stakeholders for more accessible care. And the last but definitely not the least, privacy and open dialogue. Every Filipino has the right to privacy regarding their health conditions. Openly discussing hepatitis reduces stigma, making it easier for people to seek help without the fear. In conclusion, our collective efforts are vital to addressing viral hepatitis. By advocating for political commitment, ending discrimination, and supporting public health initiatives, we can contribute to a healthier, more inclusive society. Let's talk openly, support one another, and work towards a future where everyone has equal access to health care. Thank you for your attention and commitment to making a positive impact on the health and well-being of our community. Maraming salamat po at magandang umaga po sa inyong lahat.
Thank you very much, Carlene, and to Senator Nancy Binay. So reports show that all over the world, liver cancer is one of the most diagnosed cancers, while hepatitis B and C are among the most common viral infections. Nabanggit nga yun ni Sir Hilario kanina kung gaano kalaking problema ang liver illnesses dito sa ating bansa, no? Kaya nga napapaisip tayo, are protections for people living with liver disease strong enough here in the Philippines? And what are the ongoing efforts to ensure their implementation? Now, our first panel will discuss how we can help protect the health and welfare of people living with liver cancer and viral hepatitis, especially in the workplace. Our first panelist is Dr. Daryl Lucian Bautista, a diplomat of the Philippine College of Occupational Medicine. He is currently the supervising occupational health officer from the Occupational Health and Safety Center. To discuss the current adoption of cancer prevention and control in private establishments, let us all welcome Dr. Daryl Bautista.
Good morning, everyone. Thank you. First off, I would like to thank the organizers for inviting the Occupational Safety and Health Center sa inyo pong activity, and rest assured po na that the OSHC is always in support of the advocacies, no, at sa hepatitis po, sa viral hepatitis. May I beg your indulgence kung okay lang po na bumaba ako? para po makita ko yung aking slides. Would it be okay po? Okay. 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 So the OSHC was tasked to share with you the adoption of cancer prevention and control in the workplace, especially in the private sector. So ang ipepresent ko po sa inyo ngayon ay kung ano po ang ginagawa ng DOLE, ano na po ang ginawa ng Department of Labor and Employment with regards to cancer prevention and control. The DOLE initiated cancer prevention and control in the workplace as a general guideline, no? With liver cancer included po dito. So ito pong guideline na ito na nilabas ng Department of Labor and Employment ay nire-require na sundin, na gawin ng mga workplaces sa iba't ibang sektor, sa iba't ibang lugar sa Pilipinas, no? But the private sector lang po, not the public sector. Okay? So, yan po, no? Actually, noong September 2023, the Labor Advisory number 20 or the guidelines on the implementation of the workplace policy and program on cancer prevention and control in the private sector was implemented. So relatively, ito po ay bagong labor advisory na karagdagang requirement na dapat sundin ng mga private establishments, no, para magkaroon ng cancer control and prevention policy and program. Okay? So ano po ang coverage nito? The coverage of this labor advisory are all employers and employees in the private sector. Okay? Ano yung main components of this labor advisory? First, merong health and safety measures, access to healthcare and related services, work accommodation and arrangements, and confidentiality of records and reporting requirements. Next slide, please. So, basic requirement, this is in compliance with the National Integrated Cancer Control Act. Alam niyo po ba na meron ng batas regarding sa pagkontrol ng cancer sa Pilipinas? This was promulgated and signed by then President Duterte in 2019. So in compliance with this law, naglabas po ang DOLE ng labor advisory na ito. So the basic requirement now for workplaces or in the private sector is to have a cancer control policy and program. Now, what are the basic components of these policies and program? Bakit po sinabing baseline components? Ito po yung minimum requirements na dapat meron sa cancer prevention and control policy and program sa loob ng workplace. Ano po yung mga minimum requirements? Kailangan merong prevention activities na ginagawa ang workplaces. Next, kailangan may access. The employer must ensure na ang mga workers ay may access to screening, diagnosis, and treatment. And last is, meron pong return to work compensation and social policies. No? Hindi po yung pag nagpagamot, pag wala nang chance na makabalik sa workplace. No? Isa po itong provision na ito sa policy and program na dapat firmed up. Dapat meron. Okay? Para mabigyan ng ating mga kasamahang manggagawa na may sakit, no? May cancer, na pwedeng makabalik sa trabaho basta medically cleared. Okay? And po, next slide please. Okay, what are the health and safety measures na sinasabi ng labor advisory? Ito pong sinasabi sa labor advisory, these are the, again, minimum requirements. Pwede pong dagdagan, depende sa pangangailangan ng workplace. Okay, so ano po yung una? Siyempre, yung promotion of safety and health in the workplace and safe and healthy lifestyle. Because in the workplace, our objective is prevention and not necessarily treatment. Kasi kung treatment po, hayaan na natin ang mga ospital at mga clinics at mga specialista ang mag-take care or mangalaga sa mga workers na may sakit, na may cancer. No? In the workplace, the focus is prevention. That's why it is number 1, promotion of safe and healthy lifestyle. Next, adjustment and updating of the policy and program subject to medical surveillance done in the workplace. This is an important point because kailangan yung programa at polisiya na gagawin ng bawat workplace is tailor-fit, naaayon sa needs ng company or ng establishments. Hindi po ito dekahon. Ang dekahon lang po ay yung pinapakita ko ngayon na minimum requirements. The workplace has the prerogative to add provisions to the policy and the program para mas maaayon sa pangangailangan ng kumpanya. Okay? Now, paano magagawa yon? Kailangan sa workplace may nagko-conduct po ng medical surveillance. At dyan po papasok ang mga, yung nakikinig niyo po, company physicians, company nurses. Okay? So, baguhin po natin ang perspective natin sa company physicians and company nurses. Kasi ang perspective natin, itong mga taong ito ay nasa clinic lamang, nag-aantay na magpapatingin sa workplace, magpapa-BP, pag masakit ang ulo, magbibigay ng gamot. Hindi lang po yun ang trabaho ng mga company physicians and company nurses. Ang talagang trabaho nila is to conduct medical surveillance. Ano po ba yung medical surveillance? Ito po yung proseso ng pag-monitor sa health status ng mga manggagawa sa loob ng establishmento. Okay? Yun po ang primary work nila. So, sa resulta ng pag-conduct ng medical surveillance, dyan po makukuha yung mga datos kung paano magiging tailor-fit ang programa sa mga manggagawa. Particularly dito po sa cancer control and prevention. Next, pag-conduct po ng awareness campaigns on cancer. Again, the focus is prevention. Implementation of control measures. Ito pong control measures na ginagawa ay naaayon din sa resulta ng medical surveillance. Then may prevention of stigma and discrimination. Facilitation of referral, kung paano i-refer ang mga manggagawa sa tamang institusyon at mga establishmento na tutulong sa cancer, sa health status ng worker. Return to work assistance, adoption of employee-centric program, compensation, and rehabilitation. Next slide, please. Importante rin po yung access to healthcare and related services. Kaya importante na marunong ang workplace na mag-refer ng ating mga workers na kailangan ng tulong sa paggagamot ng sakit or cancer. Okay po, next slide po. And then, yung work accommodation. Sinasabi po dun sa labor advisory na kailangang may paid leave benefit on top of the existing leave benefits. Okay? So, on top of po ito, hindi po ito kasama dun sa regular na nakikita nyong leave benefits. Okay? Pero dapat naaayon sa company policy, collective bargaining agreements, labor code of the Philippines, and other special laws. Huwag pong mag-veer away kung ano yung mga natin sa batas. Next, flexible working arrangements. Okay? Nung COVID po, nangyari na po ito. Pero for cancer prevention and control, sinasabi rin po ng DOLE na dapat magkaroon ng flexible working arrangements ang mga workers natin na may ganitong karamdaman. Okay? And adoption of other work arrangements, pwede po ang telecommuting. May telecommuting law na po, So, pwede pong i-adapt dito. Other benefits, depende po yan sa pwedeng ibigay nung workplace, but make sure that it is under the purview of existing laws po. Hindi po dapat may ilalabag sa batas. Next slide po. Okay, pagdating naman po sa pag-submit ng records and reporting requirements, kailangan po in accordance sa RA 10173. Ito po yung Data Privacy Act, Kailangan po confidential. Actually, hindi lang naman po sa liver cancer or sa cancer, pati sa lahat ng klase ng sakit sa workplace, kailangan confidential. Hindi dapat mag-leak, And also, kailangang mag-report ng employer sa DOLE, so sa different regional, provincial, and provincial and field offices, no? Which has jurisdiction over the workplace ng annual medical reports. Okay, dyan po ini-indicate kung ilan ng kaso, not necessarily identifying the person who has the condition or the illness, but the number of cases, nire-report po yan sa DOLE. Okay? So I think that would be my last slide. Tama po ba? Okay. So inilahad ko lang po sa inyo kung ano yung sinasabi na labor advisory, yung mga salient features po nito. And para po inform na kailangan sa inyong mga workplaces, meron pong ganitong policy at programa. Kung kaya't ito po ay kasama na sa tinitingnan ng mga labor inspectors natin for compliance, no, sa Occupational Safety and Health Law, which is the RA 11058. Opo. Okay? So salamat po at sana po may nakuha kayo doon sa information pagdating po sa adoption ng cancer control in the workplace. Maraming salamat po and magandang umaga.
Thank you very much, Dr. Bautista, for that very informative presentation po. I'm sure marami po sa atin may natutunan mula doon sa pinresent ni Dr. Bautista. So to continue the discussion from the government perspective, we have Dr. Marco Antonio Valeros, Medical Officer 4 of the Bureau of Working Conditions at the Department of Labor and Employment. He was a member of the technical working group that drafted DOLE guidelines for workplace health programs for hepatitis B. To discuss protections for workers with viral hepatitis from discrimination, let us welcome Dr. Marco Antonio Valeros.
Hello, good morning. Ayan. Okay, so again, thank you for inviting us sa DOLE in your General Assembly. Of course, as mentioned by Dr. Daryl, the Department of Labor and Employment has been always supportive ng inyo pong mga undertakings. Every year ata na meron kayong event, doon naman po kami nag-attend. Ayan. So nagkodigo na ako kasi sabi 10 minutes 10 minutes para mabilis Anyway, meron namang mamaya panel discussion para kung may mga clarification po you can always ask us sa mamaya. Okay? So ito po yung yung topic natin of course yung nasa harapan po natin ay dalawa pero thank you Dr. Daryl na discuss na sa cancer, so hindi na tayo masyadong mag-dwell on that, na lang tayo mag-focus doon sa hepatitis B. At of course kung tamaan man itong yung part ng cancer, it's more of yung in the context na related siya sa hepatitis B. Okay, next slide po. Okay, for the objectives, i-summarize na lamang po natin yan. Ang gusto lamang po natin dyan is to inform you on the salient features nung batas, ng dalawang batas. And of course, ma-stimulate ang atin pong mga minds na later on, hindi pa naman perfect yung ating mga guidelines. You can always provide suggestion to us on how we can still improve yung policy po natin. Okay, next slide po. Okay, so yung naka-red na part, ayan, yung equal work opportunities, yung security of tenure, at of course yung safe working conditions. Ayan, yan yung mga rights na na related dito sa Hepa B at of course sa cancer. Okay? So sa Department of Health more of sila sa treatment, prevention, treatment, ganyan. Pero sa DOLE, of course, we link, we refer to them yung mga pasyente na nangangailangan ng ng tamang gamutan. But ang nais ko lang i-emphasize sa DOLE kasi ang natin, ang focus namin is to ensure na na-enjoy nyo po itong mga rights natin as workers. So sa mga issuances namin, kung narinig niyo si Dr. Daryl kanina, no? Tinamaan lahat itong itong mga karapatan ng mga manggagawa. Ayan. So next po. Okay, so ito yung key principles ng atin pong ating Department Advisory number 5 series of 2010. I hope all of you nabasa na po itong Department Advisory na ito kasi napakahalaga po nito sa inyo. Okay, bigyan ko lang kayo ng konting trivia, no? As mentioned kanina sa introduction, I was part ng technical working group na nagdraft po niyan ng batas na yan, ay ng guidelines ng DOLE na yan. No? It was originally written, kung babasahin niyo parang department order, no? Kasi it shall be mandatory for all workplaces to implement yung hepatitis B prevention control program. Marami kung titingnan natin talagang siya. Ngayon, ang contention ng iba advisory lang 'yan. So from the perspective ng compliance, medyo sabi yan Yan. So sabi pagka advisory, medyo in terms of compliance, medyo hindi siya mandatory. Parang ganon. Kasi advice lang Unlike pag department order, gawin nyo to. But let me tell you this, sa lahat ng advisory, ito po yung advisory that finds its way doon sa inspection checklist ng aming mga labor inspector. So, in effect, mandatory pa rin siya. Okay? In fact, sa sa aming template ng OSH program na dinidisseminate din sa mga mga establishments, sa mga workplaces, kasama po yung hepatitis B sa nire-require ni DOLE. So, I encourage you na basahin po 'yon. At of course, gawin natin siyang tool when we negotiate, when we bargain. Natutuwa nga ako kasi organized kayo, Yellow Warriors, as an umbrella organization. But then, yung advocacy, yung mga nais na isulong ng atin pong Yellow Warriors, kung may mga unions po tayo sa ating pong mga respective workplaces, ensure na dapat napapaloob po yun. Okay? So, ayan. At of course, ang purpose nga pala ng pag-issue nito, kayo rin nagsimula nito, ang Yellow Warriors. Naglabi kayo, di ba, kay Senator Pia before sa Senate. And then, of course, ang sabi, habang itong RA ni Luluto, itong RA, parallel to that, dapat may workplace, Okay, so yung sa workplace guidelines nag-move forward, pero sa sa batas medyo mahirap talaga. Kailangan talaga tayong naglalabi. Ang reason kung bakit tayo naglabas ng ganito, as per statistics noon, kasi during that time hindi pa naman natin na gagather yung fruits ng atin pong yung immunization program para sa mga bata, 2000 ata yun noong time na yun, na talagang naging batas siya, mandatory. Part siya ng fully immunized child. Okay, so during that time, 20% ng population ang may hepatitis B, and the same number of people would be denied of rightful and gainful employment kung hindi natin itatama yung maling notion. Akala ng mga employer siguro, yung Hepa B parang Hepa A, na very contagious, Pero alam naman natin na ang transmission niya is hindi naman nakukuha sa ordinary yung workplace activities, In fact, sa mga lecture namin, pwede kayong magbeso, mag-share ng utensils. Basta basta walang open wound, wala tayong issue, sa pag-handle ng mga Pero of course, nandun pa rin yung universal precaution. So, yun lang ang nakita namin siguro, hindi pa ganoon ka yung awareness. Okay? So, okay, I was told na 3 minutes na lang. Okay? So, again, next slide po. Okay, ang sinasabi lamang po dito na at all levels of employment, meron tayong protection against discrimination, no? Pre-employment, nasa ano yan, ano? Hindi dapat na gawing ano yan, ano? Part ng pre-employment examination during employment, sa hiring, promotion, ayan, hindi siya pwede. At of course, sa post-employment, ano? Yung term against termination, hindi natin siya in-encourage. But then, kung magkakasakit man, of course, yung access sa ano, sa medical compensation, ini-ensure natin. Either to SSS, or as may be applicable sa ECC kung work-related. Next slide po. Okay, so yung confidentiality, we are bounded by yung Data Privacy Act of 2012 na kung saan yung hindi pwedeng i-divulge anyone yung health information ng isang individual without yung consent. Next po. Okay, so dito na siguro ako magtatapos, okay? Kasi kulang na yung oras at na-discuss na naman na yung cancer kanina. Okay? So for the general statements, of course, anong sabi po dito? Okay, yung rights ng workers embedded sa Philippine laws, We have our Philippine Constitution, we have our labor code. Okay? Tapos itong mga issuance na ito. Okay? So for the social issues na binabanggit din diyan, okay? So ayan yung compensation and benefits, ini-ensure natin 'yan. Of course, in job security, yung termination because of perceived or sabihin na nating confirmed cases without the benefit, yung thorough examination, ayaw po namin 'yan. At of course, yung discrimination, okay? And of course, yung work accommodation and flexibility. Nabanggit naman na kanina na may mga work from home tayo kung pero ang Hepa B yan hindi yan naman katulad ng cancer na Ang Hepa B for as long as carrier ka at hindi pa pumapasok yung mga complications nito na naapektuhan yung liver ka pa naman, we can still say na productive individual or productive worker ka pa rin na hindi ka hindi ka magiging burden doon sa company. Ayan. So before I forgot yung batas, it is replete with provisions on of course ang consideration natin diyan is yung prevention, of course nandiyan din yung control, at of course yung psychosocial intervention na wherein pagka may mga cases na nadi-discriminate, there's a platform for us to discuss the matter sa DOLE. But we still encourage na sa muna siya, sa plant level. Kung may grievance machinery, may grievance committee, may mga union tayo na pwedeng tumulong sa atin. If it still hindi siya nag-move forward, siguro doon lamang po tayo mag-seek ng assistance sa DOLE through single entry approach o yung conciliation mediation natin. Sa mga DOL regional field offices that has a jurisdiction doon sa establishment. Ayan. So with that, siguro yung mga tanong na lang, mamaya na lang sa panel discussion. Thank you very much at of course magandang umaga po.
Okay, thank you very much, Dr. Valeros. Very comprehensive presentation, sir. We have discussed government policies that aim to support those living with viral hepatitis and liver cancer. Now, at this point, to provide us the patient experience in both pre- and post-employment processes, may we call on officers of the Yellow Warrior Society Philippines. So, to start, may we call on Mr. JP Moscoso, please.
Hello. Pasensya na, medyo kabado lang. Konting sharing lang po about nung nag-apply nga ako ng trabaho na hindi ko alam na may sakit ako. Yun nga po, nung first ko pong nag-apply pa abroad, syempre maraming pangarap. Hanggang sa nag-apply na nga po ako, Nung natapos na po ako ma-interview sa bali tanggap na po ako, then ang pinakalas ko po is medical talaga eh. Bali handang-handa na po ako talaga mamalis nun eh. Hanggang isang araw, pinatawag po ako ng agency ko na may problema nga raw po ako sa medical ko. Yun, syempre nalungkot ako, alam ko may problema nga. Sinabihan na ako na hindi ako makakaalis. Nung pagdating ko po sa agency is nalaman ko nga na infected ako ng hepatitis B. Yun nakakalungkot lang na nung nandun ako sa agency halos parang pinagtuturo-turuan nila ako. Hindi ko alam kung natatakot sila sa akin na ay may sakit to. Kasi alam nila kung nakakahawang araw po yung sakit namin. Ayun, sa ano nga, pasensya na po. Pero, talagang ano yun, nung nalaman ko nga po na ano ako, syempre nalungkot po ako no, na hindi ako nakaalis para sa pamilya ko. Yun, talagang ano, ang kinakaano ko lang po talaga yung nadidiscriminate kami pagdating sa pag-apply ng trabaho. Ito po pinakamalaking challenge sa amin eh. Lalo bilang padre di pamilya, napakahirap pong mag-apply ng trabaho kahit hindi po related sa food industry. Kahit gwardiya ka lang minsan, mga gwardiya, kaya sa mall ka lang, dicer, may mga ganito pong ano may mga ganitong medical na hinahanap. Kaya karamihan po sa amin talaga, hirap po sa pag-apply ng trabaho. Ako po, ginawa ko na lang kung ang trabaho ko po ngayon na bilang delivery rider, yung alam kong hindi ako ma-stress na maghanap ng trabaho, hindi ako hihinga ng mga medical. Ganun na lang po talaga ginawa ko para lang mabuhay yung pamilya ko. Marami pong salamat. Pasensya na po, medyo maigsi.
Thank you, Sir JP Moscoso. And may we also call back on stage Mr. Hilario Pahak.
Good morning po everyone. So testify ko lang po sa inyo. Yung karanasan ko bilang isang employed, iba po kasi yung nag-a-apply ka pa lang at iba yung employed ka. Ako po ay employed before, hindi ko na po babanggitin kung anong company para po hindi naman po ma-discriminate din natin. Nagtatrabaho ko before sa isang chemical industry. Kung alam niyo yung lead na nilalagay sa mga laruan, na sabi nila ay nakakalason sa mga bata, yan po ang aking naging work. Actually, hinahawakan ko yan, literal. So kapag tumaas ang yung lead dyan, possible pwede kang mamatay. So meron kaming every 6 months ay kinukuhaan kami ng dugo para alamin kung gaano kataas ang aming lead. Pero sa hindi inaasahan, meron kaming tinatawag na physical exam o yung PE yearly, ay naisama po ang screening pagdating sa hepatitis B. Nung una, wala. Alam nyo, sa aming pong mga kaibigan, sa aming pong mga kapwa kadugo o ano man ang tawag o yellow warriors o ano mang sa aming pong mga kaibigan, mahirap po para sa amin na alam namin sa sarili namin dapat ito ay hindi mailalantad o mailalabas kahit sa kanino mang kasama mo sa employer o kasama mo sa trabaho. Hindi ko inasahan po ito kasi ito ay lumabas. Alam naman namin na pagdating sa pag-PPE, tanging HR and medical lang ang nakakaalam. Pero hindi ko po inasahan ito ay nalaman sa labas. So para sa akin napakahirap kasi nung ito po ay malaman, alam nyo napakahirap na yung para kang pandidirian. Sabi nga nila, palibasa hindi ko rin alam po yung tinatawag na hepatitis B. Kung talaga ba ito ay nakakahawa dahil wala po akong ka-idea pa noon. Talagang ang hirap. Alam nyo yung kakain ka, feeling sa'yo, may sakit, may kamamatay. Alam nyo sa sitwasyon yon, nakapag-isip na lang din ako minsan, hawaan ko na lang kaya kayo para magkatotohanan na. Pero sa kabilang banda, mahirap. Baka cargo de konsensya ko pa yun eh. Pero nung malaman ko, nagpa-check po ako sa isang doktor, sa Marikina Valley po, kasi taga-Antipolo po ako, nagpa-check po ako sa Marikina Doctor, hindi ko inasahan naman yung Marikina Doctor Hospital na nag-check sa akin na doctor, na hindi ko lang maalala ang pangalan, yung wife niya is carrier din ng hepatitis. So in-explain niya sa akin. Kinuwento ng doktor na yung wife niya ay carrier eh. Hindi ko naman po tinatanong, kinuwento niya. Kaya ay habang kinukwento niya, pinaliwanag niya sa akin ito, ganito, walang gamot, walang wala. So alam niyo, napakahirap. Walang gamot. Ano bang gagawin ko? Pambihira, sabi ko, ano bang gagawin ko dito? Walang gamot. Parang mag-iisip ka ng madidistress ka, magkakaroon ka ng kung ano-anong isip mo. Alam niyo, mga kaibigan, mga kapwa ko guests, in-inform ko ang HR. Sabi ko, pinaliwanag ko, detail. Ito po ang sinabi sa akin ng doktor. Palibhasa yung doktor, marunong. Nilagyan niya yung medical certificate ko na yung may DOLE advisory. Di pinakita ko. Palibhasa siguro yung HR, hindi wala din ka idea. Hindi ko rin naman masisisi. Wala din sigurong idea. So talagang mahirap. Palibhasa nakakalat na sa company. Alam niyo, parang ang hirap Yung papasok ka ng gate, paghahawakan mo yung gate, sabi ng gwardiya, ako na magbubukas. Sabi ko, Maria naman Parang talaga mapapaisip pa, gusto kitang yakapin Parang napapagano, yakapin na lang kaya kita para mapatunayan lang kung meron talaga. Pero alam nyo, sa ganong pangyayari, nakapag-decide na lang ako sa sarili ko na para matapos yung discrimination para sa akin, nakapag-file na lang ako ng resignation. Mahirap po kasi ako na mismo ang nag-adjust para sa kanila. Sana all nag-a-adjust. Ako na lang ang nag-adjust para sa kanila, para gawin lang yung parang ikabubuti ko at ikabubuti nila. Hanggang ngayon, nahirapan akong maghanap ng trabaho. Talagang napakahirap. Kaya kung ano-ano na lang pinaggagawa kong racket sa ngayon. Pero sa awa naman ng Diyos, sa tulong naman ng Panginoon, bilang isang carrier na hepatitis B, kaya doon ko nakita na teka lang, maghahanap kami ng grupo ng mga gaya ko. Kasi nakita ng wife ko kung paano ako na-depress Pero yung wife ko ang naghanap sa Facebook, kaya yung wife ko ang nakakita ng Yellow Warriors. Kaya nung first meeting namin ng General Assembly sa may Ortigas, na pagpasok ko, sabi ko, pambihira, ang dami pala namin, damay-damay na. Alam nyo kasing isip po iba Sabi ko, damay-damay na. Pero sabi ko, teka lang, dito ako magsisimula. Kaya naging thankful ako sapagkat sa Yellow Warriors, nasimulan ko ang pagbabago, nasimulan kong tumayo para manindigan sa mga kapwa ko. Palibhasa, sabi nga, mahirap pero pipilitin. Kaya sa amin pong mga taga-Yellow Warriors, ini-encourage namin kayo na kayo po ay sumuporta rin para sa YWSP. Ang laban namin, laban ninyo. Ang laban nila, sabi nga ni Pacquiao, laban nating lahat. Thank you po.
Okay, thank you very much, Mr. Hilario Pahak. Okay, ang ganda ng kwento ni Sir Hilario. Dahil dyan, sir, pababalikin kita dito sa stage, ha? Okay, at this point kasi we will now start our panel discussion. So I would like to call back on stage our panelists, Dr. Bautista, Dr. Valeros, and si Sir Hilario Pahak, and Mr. JP Moscoso. Okay? So to our attendees here in the venue po, kung meron kayong gustong tanong, mamaya po bubuksan namin yung yung panel discussion for questions from our participants po dito sa venue. Sige po. So, magandang umaga po. Kamusta po kayo ngayon? Okay naman kayo? Okay? Huwag kayo kabahan, para lang tayo nagkukwentuhan, kunwari walang nanonood sa atin. Ganyan. Ayan. So, nakakalungkot, pero it's very interesting to hear the stories of Sir JP and Sir Hilario. Anong nickname niyo po, sir? Shilo. Sir Shilo and Sir JP. Ayan. And si Dr. Valeros and Dr. Bautista. I would like to ask siguro po Dr. Valeros and Dr. Bautista, since you were talking about very good advisory ng DOLE on how to handle cases such as what they told us earlier. It's an advisory, so it's not mandatory. Tama po? ah, paano po ba dapat i-handle yung mga sitwasyon kagaya nung sa kanila na hindi tinanggap sa trabaho or na-discriminate sa workplace, sir?
Okay, as mentioned kanina, no, yes, no, sa level, may mga different levels kasi, no, ng mga policy issuances. So, as mentioned, no, previously it was drafted, ano, in the tone of, ano siya, department order. Pero, for whatever reason, di ko na lang ikikwento, no. Pagdating sa, ano kasi, sa tipsy, parang mahirap siya talagang ilabas dahil ang argument, walang enabling law, no, with that. So ang nangyari, inisyo pa rin siya as an advisory. But then as mentioned kanina, it found its way doon sa mandatory occupational health programs sa checklist ng aming mga labor inspector. So in fact, at advisory siya, mandatory pa rin po siya kasi chine-check po chine-check po yan sa inspection ng aming mga labor inspectors.
Sir, kung mandatory siya, paano kung hindi sumunod ang mga kumpanya? Gaya na lang po nung naging karanasan ni Sir JP and Sir Shido.
Okay, ano yan? Babangga naman tayo sa aming yung Republic Act 11058 o yung OSH Law. Meron kaming IRR niyon, DO 198, na meron pong mga prescribed na mga penalties for every violation. Ano? So, pag hindi sumunod, pwedeng mapatawan ng administrative, no, na multa, at of course i-issuehan pa yan ng compliance order. Pero let me tell you this, no, na yung pagpapataw ng multa hindi naman siya automatic. We still provide, no, parang grace period, no, parang period to comply para hindi naman kasi we still give them the benefit of the doubt na hindi aware yung mga employers na mayroong mga ganoong batas. So we give them 20 days para mag-comply po. Yung kay Sir JP, no, gusto ko pa lang pong i-share, yung issuance po kasi ni DOLE pang local setting, yung sa abroad, our hands are tied, no, with that. Kasi depende yan sa bilateral negotiation nung sending at receiving country. But then sana, no, yung DFA, kung sino man yung magne-negotiate, DMW, maisama yun sa negotiation na hindi siya kasi yung ibang bansa naman open po sa ganyan eh. Ang ko lang, no, yung mga Arab countries yung medyo talaga sa HEPA B. Pero yung ibang bansa, Canada, US, Australia, pwedeng pumasok pa rin, no, kahit na hepatitis B positive. Pero ito ang aim na DOLE, of course, the integration, hindi kayo ma-discriminate sa trabaho. Pero sakali man, there will be a time na talagang hindi kayo mahirapan na kayong pumasok sa work. Meron pa rin kaming pwedeng i-offer sa inyo na livelihood assistance, no? Magpunta lang sa mga regional office at of course kung anong negosyo ninyo, tuturuan kayong gumawa ng project proposal and we will more than willing to assist yung mga members nyo po, no, na nahihirapang mag-work po.
Sir, you want to add something?
Gusto ko lang pong dagdag din about the penalties po nung batas, no? If a company or an establishment failed to comply, sinabi po na senior po ni Dr. Valeros, the company may be penalized by as much as 100,000 pesos per day. No? So kaya po medyo mingipin na po yung batas, kaya po kailangang mag-comply ang mga establishment sa mga nilahad po namin kanina, the Labor Advisory 20 and the Advisory number 5 po pagdating po sa hepatitis.
I want to ask si Shilo tsaka si JP, matapos niyong maranasan yung diskriminasyon, anong ginawa niyo? May nagsumbong ba kayo? Ni-report niyo ba?
Sa akin muna, ako ang ginawa ko nung ma-discriminate ako, kasi hindi one time lang ako na-discriminate sa work eh. Yung kinuwento ko kanina is sa chemical industry. Pero 2 times ako na-discriminate sa isa ko pang work. Actually, nag-report ako sa DOLE, sa may QC dito, sa may QAB. Binigyan naman ako nila ng tama kong gagawin. Kaya lang, pero dahil palibhasa, naging busy tayo, medyo hindi tayo ganun Hindi ko siya pinagpatuloy. In-approach naman po ako ng DOLE ng mga dapat gawin, kausapin ng management, ano yung mga procedure na dapat gawin. Kasi sabi nga, dapat hindi ka nag-resign before eh. dapat lumapit ka muna sa amin. Pero dahil nga sa discrimination nangyayari sa akin sa paligid, kaya nakapag-decide ako, siyempre nadadagdag sa akin yung hirap ng kalooban at isip. Kaya napilitan akong umalis. So wala namang, basta ang ginawa ko lang, nagbigay ako sa DOLE, nag-advise sa akin ng DOLE, hindi ko nga lang naipagpatuloy kung ano ang dapat gawin. Kaya thankful na rin ako, kabasa sa DOLE, ginawa nila yung dapat nilang gawin. Ang pagkakamali ko lang, hindi ko lang naibigay yung dapat kong katungkulan. Kaya sa amin pong mga kaibigan, kung kayo po ay nadidiscriminate sa work, tuloy lang po natin and then lumapit lamang po tayo sa mga DOLE agency. Ay naniniwala naman akong tutulungan nila tayo kahit anong mangyari.
Sa akin naman yung sa discrimination talaga. Kasi nga nung nag-apply po ako, pa-abroad naman po kasi kaya... Pero may trabaho pa po kasi ako noon eh. Pero sa trabaho ko naman po, open naman po ako eh. Sa akin, okay naman sa kanila. Kaso nung bandang huli talaga nag-iiba yung trato sa'yo ng mga kasama mo eh. Parang talagang lalayuan ka nila. Parang kumukonti na lang kaibigan mo. Hanggang sa huli nga yun, nag-resign na lang din ako. Sa paghahanap naman ng trabaho talaga sa mga katulad namin, struggle talaga yun. Una lagi namin tinatanong ano kaya ang laboratory nilang hinahanap. Kasi pag nalaman kaagad namin na wala na, napapanghinaan na po kami ng loob. Yun, sa mga ganung bagay lang.
Sa advisory na pinaliwanag nga kanina ni Dr. Valencia at Dr. Bautista, JP Shilo, sa tingin nyo, paano pa natin pwedeng ma-improve yung mga mekanismo, yung mga, mga rules na meron tayo para mas matulungan pa natin yung mga kagaya ninyo?
Kung sa ako naman po ang tatanungin nyo, alam ko may kanya-kanya tayong pananaw. Pero kung ako po ang tatanungin nyo, siguro ang request ko sa DOLE, bigyan natin ng tamang seminar. Hindi ko po alam kung ginagawa ito ng DOLE. Hindi ko naman po, ito ay opinion ko lang. Kung meron po bang mga tamang seminar o orientation ang mga HR na bago sila pumasok sa isang company, alam ba nila yung tinatawag sa health? Na-orient ba sila? Para pagdating nila sa company, na kagaya ng sinabi ko, walang ka-idea yung HR. Sabi ko nga sa inyo, parang gusto kong yakapin para lang matapos. Sabi ko, parang napaisip ako, HR ka, ba't di mo alam? Pero literal, parang ganun ang naisip ko. Kaya ang concern ko, kung sa amin pong mga kapwa kagaya sa DOLE, kung sila po ay meron bang mga seminar na ginagawa, inaalam ba nila, para at least from the start pa lang, from beginning pa lang, sa interview pa lang, na ito ay reactive, dun pa lang nakikita na nila na ito ay hindi nakakahawa, hindi ganun po. Yun po ang ibig kong sabihin.
Sir, sige po.
If I may answer, sir, your concern, with regards to your concern, kung may training or may learning sessions, yes, meron po. No, the DOLE has been conducting basic occupational safety and health trainings, construction occupational safety and health trainings. Yung health part po nung training na yon, included po ang hepatitis B doon. No, plus, meron po kami mga special trainings na kinoconduct like the managing emerging health issues in the workplace and hepatitis B is viral hepatitis per se is included as a domain, health domain na dinidiscuss po doon. Tinuturo din po doon kung paano mag-put up ng policy and program basing from the provisions po ng Labor Advisory number 5. Okay, so with regards to capacitating, nagko-conduct po ang DOLE. We admit that kulang pa, no? That is why meron po rin ang DOLEng accredited safety training organizations para mas lumawak ang pag-disseminate ng information, particularly sa viral hepatitis in the workplace, no? So not only safety training organizations, but meron din pong mga OSH networks po kasi ang Pilipinas, no, sa iba't ibang dako ng Pilipinas, which also assists in the dissemination of the information. Now, ang nakikita rin po nating gap siguro is the monitoring of establishments with regards to their capacity to put up the program and implement the program pagdating sa pag-deal ng viral hepatitis in the workplace. Mabuti nga po na dumating na yung batas na 11058, yung binanggit po ni Dr. Valeros, yung OSH law, kasi mas binigyang ngipin no? Yung pag-implement ng mga OSH programs. Kasi requirement po, basta yung provisions po doon sa law na yon ay required ang mga establishments na sundin yon. At may penalty na yon. Kaya po mas dapat in the long run, no, mas maging effective yung implementation, no? With regards to documents or laws or guidelines sa pag-deal ng viral hepatitis sa workplace, meron po. Ang nagiging gap lang po is the monitoring of the implementation, kung paano po na-implement. But right now, nag-firm up at ang DOLE naman po ng inspectorate nila, no, labor inspections, no. Doon nakikita kung talaga nag-evaluate or nagmo-monitor ng implementation ng program, not just for compliance na nagsasubmit ng mga requirements sa DOLE, but also in the implementation part po, no. At saka po yung bakit hindi alam ng HR, the responsibility actually to disseminate the information comes from the safety officer because sila po yung nagtitrain sa mga basic occupational safety and health center, basic occupational safety and health trainings and COSH, construction occupational safety and health trainings. And then after ng training na yan, dapat ine-echo nila ito sa safety and health committee ng kanilang different establishments, which includes the HR po, no? So ang dapat maano po doon is kung hindi talaga alam ng HR, maybe we have to ask then the safety officer kung may trained silang safety officer, no? Kasi doon tinuturo pati paggawa po ng program, OSH programs, pati po kung ano yung components noon, itinuturo po sa safety officer, kinakapacitate. So the basic requirement is for the establishment to have a DOLE-trained safety officer para ma-echo niya kung ano yung dapat gawin, particularly din po sa viral hepatitis.
So ang ganda ng sinasabi ni Dr. Valeros and Dr. Bautista, mukhang we have all the mechanisms in place, but ang kulang talaga lumalabas is awareness and education, teaching our workers of their rights, and siguro yung mga pwede nilang gawin kung sakaling ma-violate yung mga karapatan nila. At sa tingin niyo, sir, kasi may mga final na mga panukalang batas before bills to address the concerns of our workers and people living with liver diseases din po, no? Sa tingin niyo, kung maisa sa batas ba itong mga panukalang batas na to, mas makakatulong ba para mapalawig yung awareness para mas ma-implement talaga yung mga rules na ito? Sa tingin niyo po ba makakatulong yun?
Yes po, no? Certainly, no? Makakatulong po siya ng malaki. Kasi, yun nga, as mentioned, no? Yung awareness, medyo mababa, no? On hepatitis B. I don't know, kasi pinublish naman yan sa newspaper. Tapos, lagi siyang part din ng aming Wednesday webinar, no? May Wednesday webinar ang DOLE, BWC. Nagiging yan, iniikot-ikot din yan, kasama yan sa na-discuss. Ang OHHC meron din silang parang small booklet, no, na tumatalakay din, no. Package of information para sa hepatitis B. Pero kulang talaga ng awareness. Siguro kung magkakaroon nga talaga ng enabling law, better po, no. Yung cancer, it has an enabling law. Kaya kahit pa sabihin advisory lang siya, no, lahat naman ng ginagawa doon sa advisory kasama yan sa inspection checklist namin, tulad ng pag-conduct ng HIRAC, ng mga PPE, medical surveillance, no. So in effect na-i-implement din naman siya. So siguro mas maganda nga kung meron tayong enabling law para masuportahan po yung issuance ni DOLE. At least hindi ko sinasabing hindi siya institutionalized, no? But then yung awareness siguro kulang, pero kung may enabling law, ma-strengthen natin yung implementation po ng batas.
Okay. At this point, siguro we'll open the floor for to questions from our audience. Meron ba kayong gustong itanong sa mga nandito, sa kasama natin ngayon dito sa venue? Sige, sir. Sorry,
Hello sir, good morning po. I'm Mark Canlas po. Bale, actually may clarification lang po ako kanina regarding dun sa na-discuss about dun sa policies po and the advisory from the DOLE. I'm actually po the focal person of OSH in our university in Pampanga po. Kasi bale, teacher po ako, nagtatrabaho, college professor po. Sir, itatanong ko lang sana sir yung, let's say for example po, may gusto po kaming i-craft po na policy that can be implemented institutionally po dun sa aming school about dun sa rights po ng mga may hepatitis B teachers. Ano po yung process po ng approval? Is there a need po ba na kailangan ipa-approve yung drafted or crafted policy from DOLE? Or ipapa-approve lang namin po siya institutionally?
Okay, general rule ano po, no, pagka nagka-craft ng ng policy, okay, of course, merong representation, no, from yung workers representative, no. So I guess, no, maganda na kung yung Health and Safety Committee pag meron tayong consultation with yung mga workers, no. And then yung guidelines na gagawin, dapat it must be in consonance with yung policy po ni DOLE. Kasi any deviation, medyo mahirapan tayong diyan. Kahit po may batas, ay meron kayong guidelines, pag nakita yan ng inspector, makikita pa din na hindi pa rin po compliant, So ang sabi nga ni Dr. Darrell kanina sa presentation, minimum yan, you can add, you can go beyond, na para ma-ensure yung implementation yung rights. So, pero you cannot go below. Okay? So, pagdating naman sa process of approval, sa ano yan? Sa inyo po yan. Ayan, sa inyo po yan. Kailangan siyang mapirmahan ng highest official ng school na mare-recognize ng lahat. At magiging part po yan ng OSH program na isasabit naman kay DOLE. So, for review lang kami sa DOLE, na kung sakaling hindi nga siya align doon sa policy ni DOLE, we may call your attention na ma-correct po yung discrepancy doon sa entry, doon sa guidelines po.
Sir, add ko lang po sa sinabi ni Dr. Valeros, ang Occupational Safety and Health Center po can assist you. No? Pagka po nag-craft kayo ng inyong guidelines or inyong policies and programs, you can email the draft to us and ask for inputs kung tama po ba ito, na ayon po ba ito sa sinasabi ng mga existing guidelines and laws, no? But we will give inputs and then you finalize. Then i-submit nyo. Pwede po, i-email nyo lang po sa division po namin. Ibigay ko po sa inyo sir later yung email address. So email nyo lang po doon, then ask lang po kayo ng parang inputs, pakibasa yung ginawa naming draft. And then magbibigay po kami ng inputs kung tama po yung nailagay nyo or may dagdag pa dapat na gano'n. No? So pagka po mga technical assistance po kasi we can have, pwede nyo po kaming tawagan, pwede po tayo mag-Zoom meeting para mag-ask po kayo ng audience para po mailahad nyo kung tama po ito or hindi. Magbibigay naman po, isa po sa function ng OSHC is to give technical assistance pagdating sa paggawa ng programs and policies. No, not only for cancer, not only for viral hepatitis, but all health domains po, no, na emerging sa workplace. Pwede po kaming tumulong sa inyo. Ang OSHC po kasi is technical assistance. Yung pong kina Dr. Valero, sila yung implementation arm. So sila po yung nagtitingin kung tama yung implementation. No, pagdating ng technical assistance, kami po yung pwedeng tumulong sa inyo. Pero pwede rin naman po tumulong ang Bureau of Working Conditions, pero marami na po silang ginagawa. Kaya pagka po na mag-ano po kayo ng technical inputs in your policies and programs, we can help you po. The OSHC can help you. Thank you po.
Siguro we have time for one more question po. Meron pa po bang gustong magtanong from our audience? Okay, bago po yan, sasagot daw si Sir
Magtatanong na lang po.
sige, kayo na lang po. Sige po.
Ito po ang tanong ko, Doc. Pwede po bang alisin na lang ang screening sa mga pre-employment, medical exam at sa mga employed na huwag nang isama kasi lalo na sa mga nag-a-apply na ang ina-applyan ay yung mga nasa mall, minsan may mga isinasama yung screening. Pwede po ba o possible ba na hindi na isama yung mga screening sa employed at sa mga mag-a-apply?
Yes po, no. In fact, kasama po 'yan sa sa nakasulat doon sa Department Advisory number 5, no, na yung hepatitis B screening at of course maging part siya ng pre-employment annual medical exam, hindi po natin siya hindi natin po siya inaalaw doon sa batas. Okay? Magiging lang siya, magiging maalaw lang siya sa mga pagkakataon na merong immunization program. Kasi part yan bago ka bakunahan, kailangan makita yung hepatitis B status. But then, yung confidentiality dapat ma-observe. Sabi nga ni Sir, dapat yung mga medical personnel lamang ang merong merong access doon sa information. So posible naman po, Pero of course, we need your help sa bagay na ito. Kung meron kayong nalalaman na mga workplaces, mga establishments na nagpa-practice ng ganon, you can report the matter sa regional office ng DOLE na meron jurisdiction sa inyo for them na mag-conduct ng complaint inspection, ma-call yung attention nung employer na hindi siya inaalaw ng batas. Ayun. So yun, siguro maging open lang yung natin, communication line. Ang hepatitis B, sabi nga natin yung niya, napakadaming 20%, pag natin. Pero kung magsasama-sama tayo, sabi nga natin, whole of multidiscipline siya, whole of society approach. Kung magtutulungan tayo, yung awareness, medyo ma-address natin yan. Sana makasama po namin kayo sa layunin na ma-inform po kami at mabawasan natin yung discrimination po sa mga respective workplaces.
Idagdag ko rin lang po that yung pong concern po ni Sir, it must be industry specific. Hindi po kasi lahat ng industriya pwede nating alisin yung screening. May mga categories po kasi yan. Kung healthcare worker ka, nagpe-perform ka ng mga procedures that maybe malaki ang propensity for hepatitis transmission. So kailangan ng screening, So dito po papasok yung medical surveillance. Kaya po kung makikita nyo, nakalagay dun sa measures na kailangan ma-update kung ano yung dapat gawin ng company pagdating sa policies and programs nila dun sa ginagawang medical surveillance sa loob ng workplace. Doon kasi nalalaman yung need ng kumpanya, kailangan nating mag-Hep B screening kasi ganito yung proseso sa ating industriya. Malaki ang exposure ng ating mga workers na pwedeng magkaroon, lalo na sa health ng liver. Kung exposure siya sa kunyari may chemical exposure siya na may lead to liver malfunction, pwedeng magkasakit sa liver, tapos meron pa siyang hepatitis B na carrier siya. So baka mas mataas yung magiging propensity niya na magkaroon ng sakit sa atay. So yun po yung mga kailangang i-consider. Kaya importante na merong nagko-conduct na medical surveillance po sa loob ng mga workplaces para malaman natin kung work-related ba itong hepatitis B infection na ito. Ngayon, kung hindi naman talaga, kasi may category naman po talaga na other industries, wala naman po talaga exposure na pwede. So pwedeng you may not do the screening, just yung sinabi po ni Dr. Valero. So importante po na i-tailor fit yung mga polisiya at programa. We cannot generalize po kasi sir na alisin all throughout in all industries yung hepatitis screening po. Thank you po.
To add lang pero whatever yung result nung screening doon sa healthcare, it must not be yung parang maging gauge kung i-hire ka o hindi. Lang yan, guidance lamang po yan sa pag-i-issue ng fitness to work, yung work assignment na kung saan pwede kang i-assign ng inyong mga occupational health physician. Yan. So definitely yung discrimination in any workplaces hindi tinatolerate po ni DOLE. So lang yan, guide lang yon. Tsaka sabi nga ni Sir kasi kailangan natin ng baseline para sa easy compensation. So very important na meron test po talaga nila. Kasi pag nagka-Hepa B ka, ang understanding noon, mayroong strong correlation na ka sa patient. Gano'n. So yun lang po.
Thank you. Sabi nga ni Dr. Valeros kanina, no, it's a whole of society approach. Each and every one of us, tayong lahat, may role na ginagampanan sa pagtulong sa mga patients or persons living with liver diseases. Hindi lang sa kumpanya, hindi lang sa dole. Tayo bilang mga workers, kailangan aware tayo sa mga karapatan din ng mga kasamahan natin, di ba? I know, minsan, pag may narinig kang chismis, pag may narinig kang balita, parang ang saya maging marites, makipagkwentuhan, di ba, tungkol sa mga yon. Pero sana dapat maintindihan natin yung consequence ng mga actions natin, di ba, na kapag pinagchismisan natin yung mga kasamahan natin, gaya nga ng sabi ni Shilo kanina, it can cause depression, it can really hurt them, not just yung emotions nila, pero pati yung hanap buhay nila. Pwede silang mawalan. Kaya, sana yung mga nandito sa atin ngayon, ma-share natin yung ganito para makausap natin yung mga kasamahan natin sa trabaho para hindi na magtuloy-tuloy yung hindi magandang practice sa workplace din, di ba? And on that note, maraming salamat po sa ating mga panelists. Let's give them a round of applause, please. Maraming salamat, Dr. Valeros, Dr. Bautista, Shilo, and JP. We have a certificate of appreciation. Wag mo na kayo umalis dyan. Ito. Bigay natin sa kanila. Okay. Sige. Babasahin ko muna ha. UHC Watch, Chatbase, ADR Institute, and Yellow Warriors award this certificate of appreciation to Hilario Pahak, and to our other panelists for his active participation and valuable contribution as a panelist in our event today, held on this day, January 19, 2024 at Luxent Hotel, Quezon City, Philippines. Okay? Pwede na natin ibigay. Ito kay Shilo. Yay, thank you. And photo op tayo. Ayan, sama kayo, sir. Okay, pati yung gift. Ayan, may gift din daw kayo. Okay, thank you very much. Okay. Okay, so diretso na tayo sa second panel natin, no? Sabi nga kanina, liver cancer and viral hepatitis are very important health issues. At isa sila sa pinaka rampant na liver diseases dito sa ating bansa and all over the world. So to further discuss how these diseases affect people and how government interventions can be improved to help more Filipinos, we invite our second panel on stage. To give a talk on the state of liver cancer and viral hepatitis in the Philippines, let us all welcome Dr. Jen Agkawili Conde, Secretary of the Hepatology Society of the Philippines.
Okay. Ayan. So good morning to everyone. Again, thank you so much, Yellow Warrior Society of the Philippines, for inviting us, the Hepatology Society of the Philippines, to talk about the liver cancer and viral hepatitis in the Philippines. Of course, congratulations for this wonderful gathering, event on enriching our members of the community on how do we give awareness and giving help to our patients with hepatitis, viral hepatitis B and C, and even with patients with liver cancer. Okay, so I'm tasked this morning. I think it's very unholy na. My timing is very good, no? Kasi kumakain kayo. Pero anyways, okay lang yan. Just lend me your ears na lang. So this morning, I am tasked to discuss to you about the burden of liver cancer and viral hepatitis in the Philippines. So as we know, we're talking early this morning that liver disease is a major public health problem, not only in the Philippines, but globally. No? So the latest estimates from the World Health Organization that liver diseases cause about approximately 2 million deaths in last 2019. So can you imagine, all over, around the world, 2 million ang namamatay because of liver diseases. So in the Philippines, in our country, a problem, there's because we are maybe a lower to middle income country, accurate statistics of the burden of the liver disease is lacking. So, however, according to the recent data from the Philippine Statistics Authority, liver diseases accounted to 27.3 cases per 1,000 deaths in the country in 2020. So, can you imagine that, no? So, in 1,000 deaths or sa 1,000 namamatay sa Pilipinas, 27 of those cases because of liver disease. Okay, so the outline of my talk, of course, we'll discuss the main meat of our discussion is because of viral hepatitis, more importantly, the hepatitis B and C, no? As you know, viral hepatitis, A, B, C, D, E, yan, no? Hep A, ito yung sinasabing kumain ng madumi, ng ihaw-ihaw, hindi naman sa ano, no? Yung mga tusok-tusok, pero yun nga, yung biglang naninilaw yung pasyente, nagkakaroon ng trangkaso. However, the good thing with hepatitis A, kusang gumagaling yung pasyente. However, that is yung in contrary with the hepatitis B, no? The problem, worldwide, wala pa ho talagang gamot or tableta na kayang tanggalin yung virus sa atay. So usually, once we had the hepatitis B or a patient had hepatitis B, usually he carries it over lifetime. No? Only less than 1% ang meron pa rin na gumagaling. Yun nga lang, I will always, yung sinabi ko sa patient ko, para kung tumama sa loto nun. Pero, posibleng mangyari yon. Okay? Yun lang, sa Hep B, hindi yan katulad ng sinabi, hindi yan katulad ng hepatitis A na nakukuha sa pagkain. So, we always educate na ang Hep B and Hep C is through body fluid exchange or blood-to-blood contact. So, either natusok ba kayo ng karayom na hindi malinis, or nagpa-tattoo na hindi malinis yung ginamit na needle, or nagpa-ear piercing. However, as we always say, 70%, based on data, 70% ng mga Pilipinong may hepatitis B, usually nanggagaling sa nanay na ipapasa sa anak. So yun yung sinasabi nating maternal fetal transmission. Hindi yan mana, no? Kasi yun ang sabi laging iniisip ng patient, ay minana ko yan sa nanay ko. Hindi po, kundi hawa siya, no? So I always educate, part of my education to my patients with Hep B, na mana yan, ay mahawa yan, hindi mana. No? So, nung pinanganak ka, may nalunok kang dugo, kaya ka nagkaroon ng hepatitis B. So, we always advise patients na may Hep B, kailangan ipapascreen nyo rin yung mga kasama sa bahay. Mga nanay at tatay, mga kapatid, asawa, or even yung mga anak. Para, pag hindi nila alam na may Hep B, kasi syempre, yung ibang kasama natin sa bahay, hindi naman nagpapacheck. Yung mga nanay at tatay natin, bihira lang. Pag magkasakit, doon lang magpapakonsulta. So, that's why we advise, para in case na wala silang hepatitis B, magpa-vaccine. So, that's the beauty of Hep B. We can prevent hepatitis B through vaccination. And we have proven the worth of vaccination through this pandemic, yung COVID-19, di ba? Through vaccine, na-reduce natin yung numbers. The same goes with Hep B. No? We can prevent transmission or the numbers of hepatitis B kung magpapavaccine tayo. So, it's good to know na malaman natin kung ano yung status natin. Para in case na walang Hep B, yung mga mahal natin sa buhay, i-advise nyo silang magpa-bakuna. Ayun. So, of course, as we know, part of my sharing pala itong morning, hindi talaga lecture. Okay, part of my sharing, as we know, is liver cirrhosis, no? So, pag napabayaan ng Hep B, hindi nagpapa-check up, no? So, pwedeng mauwi sa pagkasira ng atay or yung tinatawag na nating liver cirrhosis. And worst case scenario, pwedeng mauwi sa liver cancer, no? Having hepatitis B is a risk factor in developing liver cancer. So, that's why we really advise all patients na lahat ng may hepatitis B, na very important to check up or to follow up every 6 months to see your doctor para nakakatch natin ng maaga. Para maliit pa lang, nagagamot kagad. Hindi po porque nagkaroon kayo ng liver cancer, end of the world na. Hindi po. May gamot po sa liver cancer. May mga solusyon tayong pwedeng gawin para mas humaba po ang buhay ng taong may liver cancer. So yun po. So liver cirrhosis usually accounts about 31% or 32% no, of liver-related deaths. And malignant diseases around 36% of deaths, no? So why do we have this kind of sharing, no? Why we do give importance, no? So ang main purpose natin because of viral hepatitis. So in globally, around 325 million people living with chronic hepatitis infection. So hindi lang po dito sa Pilipinas, no? Marami rin po sa ibang parte ng mundo ang may hepatitis B. Kaya yun din ang sinasabi ko, no? Yung may mga nag-a-apply, nagtatanong, Doktora, i-clear mo ba ako? Kanina nag-a-apply sila sa abroad. Sa totoo lang, syempre, locally, I can give you clearance. We have the power, no? However, we cannot really totally tell pagdating sa ibang bansa. Pero katulad nga ng sinabi ko, malamang tatanggapin ka rin sa trabaho kasi marami ring Hep B sa kanila, marami ring hepatitis C sa kanila. So it should not be a hindrance for you guys to apply, no? It's it's better na alamin lang natin kung ano yung mga guidance nila, kung ano yung mga restrictions para hindi tayo hindi tayo nalo-lost in with regards to having the hepatitis B. Okay? So we give importance because as we know, around the world, there is an increasing death because of hepatitis B and even liver cancer. So in our country, the Philippine prevalence, so around 11,569 are cause of death because of the viral hepatitis and around 378,000 yung daily loss ng mga pasyenteng may hepatitis B. So, okay. Sige. So, for viral hepatitis, as we know, the most common is the hepatitis B. And this study showed that 1 out of 6 Filipinos are infected with Hep B. So, ganyan tayo kadami, no? So, that's why ang problem, about 9.7% or representing about 10 million have chronic infections with hepatitis B. So projected in the next 2015 to 2030, there would be an increase in rise around 20 to 30% in morbidity and mortality. So kung hindi tayo mag-a-act ngayon, baka ma-achieve natin na ang hepatitis, ang number 1 na malalagpasan natin, ang HIV, ang malaria, ang tuberculosis to be cause of death if we don't act now. So mortality, yun nga, as I've mentioned, mortality and morbidity with regards to viral hepatitis is increasing. Yan, as I mentioned, no, by 2040, they projected that we will increase the numbers or will surpass the numbers of HIV, malaria, and TB if we don't act now. Okay. So as you know, yun nga, there's really an increasing in number of hepatitis B. So I will just like to show you in this slide that majority of the patients with hepatitis B, around 30 no to 40 years old yung mga nadedetect or nadadiagnose. Bakit? Ito yung age group na nagtatrabaho kasi tayo, 'di ba? Minsan yun nga, as mentioned, it's a double-edged sword na yung screening sa opisina, minsan doon lang nalalaman ng pasyente, ay may Hep B pala ako. 'Di ba? Yun lang din, of course, ang lang doon, ang caveat noon is minsan yun nga, they feel discriminated, kaya hindi ako tinanggap sa trabaho dahil may Hep B ako, no? So, as mentioned earlier, no, it's really industry related kung saan ginagawa yung screening for patients with hepatitis B. Okay. So in this slide, I would just like to show you the numbers of hepatitis B, no? So as you can, ayan. So the numbers of hepatitis B. Okay. So There are a lot of numbers that are being diagnosed, and annually diagnosed, only 3,400 patients are being treated, or very few numbers would receive a liver transplant. And yun nga, only 41% is, yun nga, only ilan lang, 6 transplants in 2018, no? So that's why it's part of the advocacy also of Hepatology Society of the Philippines, yung promote or yung sa organ donation, no? Kasi yun nga, nahuhuli tayo sa Pilipinas with comparing to our surrounding Southeast Asian countries such as Singapore, India, in the numbers of liver transplant. And to think na ang dami-dami nating may Hepa B, ang daming may cirrhosis, ang daming may liver cancer na nangangailangan ng liver transplant. Okay. So in this slide, I would just like to show you na marami ring women of childbearing age with hepatitis B and with high viral load. So what's the importance of this? I'd just like to be an eye-opener, no? Na importante ho sa lahat ng mga nagbubuntis na magpa-test din po for hepatitis B. At kung may hepatitis B, magpa-check up po para kung kailangan nyo ng gamot para ma-reduce yung number ng virus sa atay nyo para mas less yung transmission sa baby. So, yun yung gusto kong iparating with this slide. Na importante na para ma-less natin yung transmission ng hepatitis B, mas syempre kukonti yung numbers natin. Okay? So, there's a country, in Hepatology Society of the Philippines, we have a lot of programs, no? We work with Yellow Warrior Society, with Sir Chris, Mr. Pahak, recently, no? So, we work in awareness, in preventions, of course, to decrease the discrimination and stigmatization of patients with Hepa B, testing services, and treatment services. So, for awareness building, we always celebrate this month as the Liver Cancer and Viral Hepatitis Awareness Month. So we have a lot of programs, and as well as we also celebrate World Hepatitis Day. So from Hepatology Society of the Philippines, we have this Facebook page, yung Be Aware. So kung we invite you, no, to follow our Be Aware page kasi you can have a lot of information with regards to hepatitis B. At kung may mga programs din kami, mga lay forum, or may program, for example, free screening or free medications, vaccination, dun namin pinaparating sa aming Be Aware page. Yan yung lay arm namin. So, yan. Yun nga, as mentioned, we have the World Hepatitis Day. Last year, we celebrated it in Ormoc, Leyte. So we have a lot of guests there. And then, together with the Occupational Society of the Philippines, we also give lectures sa mga opisina, such as example yung sa MDC, sa Makati, no? To inform or to give awareness sa mga company and sa mga pasyente kung ano ba yung kahalagahan ng hepatitis B or in general, yung importansya ng pangangalaga ng atay. Okay? So, recently we had yung parang opening salvo namin in celebration of the Liver Cancer and Viral Hepatitis Awareness Month is the, yun nga, liver run. No? So, to promote health then, liver health for all of our Filipino patients. And then, yan, this month, we have a series of lay lectures, no? So maybe nare-receive nyo rin sa inyong Facebook page, sa inyong Viber group. We invite the Yellow Warriors to attend our Zoom lay forum, no? So actually, mamaya meron eh. Yun. So yan, online para lahat nakaka-attend. Yan. Okay? So for prevention, we really advise or advocate vaccination. Yan. And then for stigmatization, we support the DOLE advisory. And also, we're trying to lobby sa Congress natin. So from our group of doctors, we try to approach our senators, no, like Senator Bongo, Senator Hontiveros, Senator Pia Cayetano, yung mga members ng and even the Congress, yung sa lower house, para isulong yung blood-borne viral hepatitis or yung anti-discrimination. So I hope we work hand in hand para matuloy na tong bill na to para for everyone's benefit din. Ayan. Okay? So I think So I just like to show you, we work also hand in hand with the DOH, with the government, no, in implementing yung mga programs nila, no. So I think there is a pilot program already yung sa hepatitis B on giving free testing and giving free medication so those who are in need, no. So yan yung parang isang program nila na fina-follow namin. And from the HSP, we do give lectures also, no? Sa mga barangay health workers, we're trying to tap in also sa mga midwives to give lectures also for to educate them on how to handle patients with hepatitis B. Ayun nga, we work with our general physicians, family physicians, sa mga occupational doctors, and from an internist, no, to educate on how to clear patients, on how to handle or diagnose patients with hepatitis B and how to treat them. As we know, yun nga, medyo konti lang kaming mga specialists, mga hepatologists. That's why, as part of our advocacy, we educate everyone on our colleagues from the medical field to how to diagnose, treat patients with hepatitis B. Okay? So yun. So I think I'm time's up na. So I just like to show lang, no, pag sinasabing burden, ang laging isipin yung economic factors, no? And there's this study, no? There's a study that tried, no, magkano ba ang ginagastos ng isang Pilipinong may hepatitis B? Yung pag-diagnose pa lang, pag nag-start siya ng gamot, paano pag nagkaroon siya ng liver cancer, paano pag nagkaroon siya ng cirrhosis, no? So, yan yung mga estimates. At kung makikita nyo, napakalaki ng ginagastos ng isang taong may hepatitis B. So that's why, yun nga, we appeal sa government, sa DOH, na yun nga, I think with the new UHC, no, kasama na yung libreng testing, libreng gamot for hepatitis B. So as you know, yun nga, magkano bang kinikita ng isang Pilipino sa isang buwan? Tapos, paano pag may hepatitis B pa ako at may naggagamot pa ako? So halos yung buong sweldo ko nandun na sa gastos ng gamot. No? So I think this gathering is really very important for all of us, no, to wake up everyone, tulungan tayong mga pasyenteng may hepatitis B, cirrhosis, and even liver cancer. So, surpassing lang, hepatitis C accounts about 0.92% prevalence in males and 0.94% in females. So, ito yung mga common data for patients with hepatitis C, no? And, yun nga, economic factors din. Biruin nyo, magkano ang ginagastos ng pasyenteng may hepatitis C. The good thing now with hepatitis C is may gamot na po. So, wag mawalan ng loob. Pag na-diagnose kayo may hepatitis C, kasi gumagaling po kayo, may gamot na po. No? So, I think the government also is trying to procure medications or medicine to give us free medicine for patients with hepatitis C. Kasi kung titingnan nyo, magkano ang gastos ng pasyente kung nagkaroon ng hepatitis C, ang laki. Diba? So, yun. So, the global, so the global health sector, or there is really a strategy, by hopefully, we are one with the World Health Organization that by 2030, we decrease the numbers of viral hepatitis. We achieve this target, that there is a decrease of 90% of new infections and 65% of viral hepatitis death. So, yan. Okay, so for cirrhosis, ayan, marami ring namamatay for cirrhosis. And as you can see, kung magkano ang ginagastos din pag nag-develop tayo ng cirrhosis. So it's really very important to really check out on your doctors, follow up on your doctors para hindi tayo mag-develop ng cirrhosis or end-stage liver disease. Okay? Next, lastly, is the liver cancer. So for liver cancer, as we mentioned, it's the 6th most common diagnosed cancer and 3rd most common cause of death worldwide. No, actually, 2nd na siya. First is lung and 2nd is the liver cancer. Here in our country, 4th siya. First is the lung, the 2nd is the breast, 3rd is the colon cancer, and pang-apat sa atin, yung liver cancer cause of death. So mataas pa din siya, no? So yun yung problema. So there are a lot of cancer deaths in our country. So that's why it's really very important na at magastos, yun nga, yun, famous cliche, magastos magkasakit. So that's why we really advocate na awareness. We are one with you in awareness, in collaborating on how to prevent liver diseases in the Philippines. Okay? So, again, I think this wrap up my talk. So, thank you very much.
All right, thank you very much, Dr. Jen Agawili Conde, for that very comprehensive presentation. Now to discuss the Department of Health's initiatives to support liver cancer and viral hepatitis patients in the country, may we call on Mr. Vincent Sumergido, Supervising Health Program Officer at the Disease Prevention and Control Bureau. All right.
Thank you. Good morning, everyone. And siguro no, we'd just like to thank the organizers for inviting us. So this month is Viral Hepatitis and Liver Cancer Month. So it's really under our division. That's why andito po kami ngayon to really support you in this kind of endeavor. And siguro, while listening to Dr. Jen, she just went out, she really emphasized the importance of prevention kasi kung makikita po natin, the cost in terms of treating later on is really, really expensive, and that would take a lot of toll in terms of government support and sa atin sa gobyerno in terms of financing all these needs. So with that, I just want to show you the slide. No, next slide, please. Okay, so that day when we talk about health, we seem to have that connotation. Health is about getting access of medicine sa hospital. Dapat nakakapunta tayo sa health center. Pag pumunta tayo sa hospital, dapat may free ang medicines. Libre lahat. So things like this are the concept of health before. But when you look at this one, this is a study actually done. So what makes a Filipino healthy? So kung titignan po ninyo, the green one is about the healthcare. That's about access. Yun yung sinasabi ko na when you go to the hospital, you have available meds, you have bed that will accommodate you when you get sick. That's about access to healthcare. But there is also a big chunk outside healthcare that causes or that can make us also healthy. So look at for example, the 40%, the socioeconomic factors, our education, di ba? Our job status. Kung wala kang job, di ba? How can you finance your health or how can you eat healthy food? So things like that. The community you are in right now. Paglabas mo ang binibenta ganito yung mga pagkain or dirty foods, for example. So you would also be more likely adopting that bad habit, diba? So that's one. Then there's also physical environment. The workplace that you are in right now, for example, if that's hazardous, you will be most likely getting infected then. For example, they're not practicing yung mga safety injection practices. So if you're a nurse, then most likely you'll also be infected, diba? So that's one. Then the last would be the 30% is about healthy behaviors. So the way you practice your health, do you smoke ba? Do you also eat or do you exercise? Okay, so these things actually, when you add this up, that's actually 80%. So 80% is of making your body or a Filipino healthy is actually outside the health sector. So ano pong ibig sabihin nito? This means that in order for us to be healthy, we have to have that big intersectoral work. So this is not the work only of the Department of Health. Kaya andito din po yung DOLE. Okay? Andito din po yung mga other sectors natin of society, the education sector, etc., to work with this in order for us to achieve this goal. So the World Health Organization actually released this data. So sinasabi ng World Health Organization, 90% daw, almost 90% of people living with hepatitis are not aware, okay, that they have it. So meaning kung hindi sila aware, chances are they might be transmitting that to others na hindi nila alam, or at the same time, kung hindi nila alam na may hepatitis sila, later on they will already succumb to, for example, severe disease, di ba? And then it's too late kung pag nakita na sila ng kanilang doktor. So this means that in order for us to make sure that these Filipino na not aware, there must be a really strong intersectoral work. So yun po yung emphasis namin, intersectoral work. So we work with the Department of Interior and Local Government, we work with the Department of Education, we work with private societies, the doctors, okay? We also work with PhilHealth for financing and all other sectors to make our lives easier and better. So this is timely, no? Kasi with the new management right now, sorry, hindi ko na napakita. Okay, next slide. With the new management right now, under Secretary Ted Herbosa, Secretary Ted outlined actually the 8-point agenda. So this is now the priority of the health sector in terms of advancing the health of all Filipinos. So meron po tayo mga priority dyan sa bawat Pilipino, bawat komunidad at bawat health worker. So in this priority agenda, kung titignan po natin, viral hepatitis and liver cancer is also incorporated in here. So for example, ang bawat Pilipino ramdam ang kalusugan. So that includes making sure that each of these health services, screening for example on the ground, is also accessible to all who needs it. So that is one priority. That also includes financing our primary care. So PhilHealth is also working hard right now to make sure na yung mga screening sana mapa-free natin, or we can cover that with financing para hindi na tayo mag-out-of-pocket expenses. So that's one. The other priorities in terms of ligtas, dekalidad, at mapagkalingang serbisyo. So this means that we wanted to make sure that the medicines that we have is also affordable and also accessible to everyone. So it doesn't mean na all medicines will be really for free, kasi most likely that's not really realistic, no? Pero government as a hand to make sure na ang binibili po nating gamot are quality, safe, at the same time affordable po siya. So parang may co-financing tayo na parang yung out-of-pocket expenses natin would not be that too high, pero at least at the level of the Filipinos right now, they can afford it at a certain degree. And then number 5, this one focuses ang pag-iwas sa sakit. So this now refers to the slide I had earlier about enabling healthy behaviors, not only for us, di ba, but also at our community, our workplaces, kaya dito ang DOLE, and also at even our schools. Okay, that's where sometimes our development and our education starts. Okay, next slide please. So this is just to show you know the different interventions right now that the Department of Health is undertaking to make sure that healthy behaviors are the easier choice for everyone and for everywhere. So there is a campaign in the DOH that we call the Healthy Promotional Campaign. So meron po siyang 7 priority areas. And kung titignan po ninyo dyan, that 7 priority areas is also the focus, or it also cross-cuts and affects the viral hepatitis. So that includes diet and exercise, environmental health, vaccines and immunization, I will explain it later on, substance abuse, sexual and reproductive health, mental health, and violence, injury, and prevention. So these are the priority areas, meaning the health promotion intervention are directed to target these priority areas so that we make sure that every Filipino is aware na ang areas na ito are these are the things that they have to really improve on in terms of making healthier choices. And not only that we focus these areas, no, pero we make sure that these are also integrated into 3 important settings. So that includes healthy community, so sa mga barangay natin, sa mga munisipyo, we have this available, kumbaga, and then it also includes schools and workplaces. Sige, so next slide. So I just want to emphasize in this slide, no, the prevention is the key, and we understand na hepatitis can easily be transmitted from mother to child. That's why one of the services that the Department of Health is also providing to the public for free is the hepatitis B screening for mothers, so prenatal natin. So it's very, very important na the prenatal services must be available on the ground kasi if you are found to be positive, if the mother is found to be positive, then that mother can be given actually medicines para pag manganak po siya, the transmission, yung sinasabi kanina ni Dr. Jen, the transmission could be very, very low. And then the chances of infecting the child is also low, di ba? So we reduce that kind of transmission dito pa lang sa pregnancy. Next slide, please. And then, once the child is already born, we also put emphasis on vaccination. Kaya it's really important that the WHO is also emphasizing the importance of vaccinating hepatitis B within 24 hours. Kasi it really protects you at least at a percent, 90% against hepatitis B transmission during at birth. So this is available in our health centers. This is free. Okay? Kaya sabi ng mga pediatrician, medyo hindi na nga sila kumikita kasi yung mga lahat ng bakuna na binibigay na po sa ating mga health centers for free. So this is given at within 24 hours. And then we have also other opportunities after that. No? May second, third, and fourth opportunity for vaccination in the form of pentavalent Hib given at 6, 10, and 14 weeks. So this is also for free. Next slide. Okay, so when you are already infected with hepatitis, there are also treatment interventions that are in place sa government sector. So that includes screening services and antiviral medication. So we know na it's not really enough no ang binibigay nating gamot right now because the viral hepatitis program is new. So what you call this yung mga investments are just coming in and we're just trying to put up more resources to fund this. But rest assured that later on, we are looking towards expanding this kind of intervention so that this would be available for all the high-risk patients natin. So we also have financing interventions. We have consulta package. I think our colleague from PhilHealth will discuss this more later on. And then there's also what we call the Malasakit program. I think you've heard this, no? Yung MAIP natin. So this is the medical assistance for indigent and financially incapacitated patients. So I think that's the critical one. Kasi dati akala natin, indigent lang yung pwedeng mag-avail ng MAIP na ito. Pero in fact, if you're also financially incapacitated, di ba? Even if you have work, pero you have cancer, you have this debilitating disease, uubusin niyo talaga yung pera mo. So you could be eligible for this. So this is also accessible in our government hospitals. I think there's 159 hospitals nationwide that we have malasakit centers that you can tap this. And that includes inpatient and outpatient services. Okay, and then we have DSWD, we work with DSWD. We have also PCSO and HMOs for other financing. So I think I have the last two slides, please. I think this is critical, no? So next slide, next slide. Okay, when you have hepatitis, sinasabi kanina ni Dr. Jen, the chances of developing liver cancer is also high. Kaya if you notice, the program na viral hepatitis is in our division, which is the cancer control division. So in our division right now, we have also interventions to address the burden of cancer. So liver cancer is part of the focus cancers that we are trying to intervene. And we have already been providing different medications and cancer medicines. I think right now that's around 61 molecules na we are providing for free. So that cross-cuts different cancers, and liver cancer is one. So kung makikita po ninyo dyan, tumataas po ang mga bilang ng mga tao na nag-a-access ng cancer medicines namin. Kaya kung masasabi nyo, ubos parati yung gamot, yes, we understand na uubos po talaga siya kasi the number of patients that are also accessing is also very, very high. So kung makikita po ninyo, 20 to 22% ang napoprovidean po namin ng tulong based po sa budget that we have and the medicines that we procure. So there's a lot of work more to do to increase this one. But I think the importance here is that if we put our resources in treating, I think that would not be really strategic. The strategic option is to displace or to focus our interventions, our financing in terms of health promotion, screening, and early prevention. Kasi from that, pag na-stop na natin, we don't have to put our resources to buy more medicines, di ba? Okay, so minamadali na po ako. So last slide. I think next slide. I think this is very important kasi dito yung mamaya sa questions they will ask and how can we avail. So I think this will answer. Pero we also understand no aside from medicines, there are also other costs, 'di ba? Na kailangan ng pasyente. For example, indirect cost with the transportation that you need from your house going to the hospital is also critical. Sometimes that is also an access barrier. So there is what we call right now the Cancer Assistance Fund that was implemented by the government to support cancer patients. So this one is a very much bigger, a broader fund kasi it can provide you a support in terms of diagnostics and laboratories. Dati kasi di ba medicines lang, pero ngayon we provide support in terms of diagnostics and laboratories. Therapeutic procedures, yung kailangan mo mag-bone marrow biopsy and everything, so that can be covered. Augmentation for cancer medicines, kung kulang pa po, that can also be that can also covered by the Cancer Assistance Fund. And here, prevention, screening, and diagnostics and other support services such as indirect costs. Kasi we understand na in order for us to tackle this disease, the burden of this disease, we have to make sure that we have financial support in terms of prevention, screening, and diagnostics. So sinasabi ni Dr. Jen kanina, if you are a person living with hepatitis, you are at high risk for developing liver cancer. So under the Cancer Assistance Fund, if you are a hepatitis B positive, for example, you have a doctor's prescription, you just go to one of our access sites. Next slide, please. Okay, you can access actually screening and diagnostic to make sure, diba, to check for you to check no kung you have already signs of cancer or developing that one, so that we could stop it at an earlier stage. So this is the list of the access sites that we have. So currently we have around 35 access sites nationwide. We're trying to expand more, pero when we say expansion, that would also entail a lot of budget. Right now, the cancer division has already around 1.2 billion pesos na fund for this one. Pero dati 500 million lang. So ngayon medyo nagdodoble. So siguro in the next few years it will also increase. But again, as what I am emphasizing, it's really important for us to focus our interventions in the health sector, at the same time in other sectors in terms of health promotion and early detection and screening. So last slide, super last slide. So ways forward, no? We understand na there are challenges in terms of addressing the burden of viral hepatitis. So right now we're working to increase the screening for mothers. Part of that is to improve our vaccination coverage for hepatitis B for infants. And then at the same time, we're looking into how we can really maximize our resources to increase the augmentation of hepatitis medicines. May sinasabi parating Hepatology Society na ganito yung bilhin nating gamot. So we do that study to check na kaya ba natin itong bilhin, up to what to extent, di ba? So these are the things that are being done right now. And then we were also working with PhilHealth to develop viral hepatitis and other cancer benefit packages to really address our needs of the country. And there is also an ongoing product selection, a review of our product selection. Yung sinasabi ko, do we need to really change the medicines that we buy so that this would be really responsive to the needs of the Filipino right now? So I think yun lang. Those are the directions that we're undertaking right now, and thank you for giving us the opportunity to really shed light and to provide you information na ito po yung available na tulong na galing po sa inyong gobyerno. Salamat po and good morning.
All right, thank you very much, Mr. Vincent Sumergido. Now, PhilHealth, as the National Health Insurance Program Authority, is an important part of the country's health system. Now, joining us virtually to discuss PhilHealth's primary care benefit package is Ms. Ana Liza Pastrana de Leon, Senior Social Insurance Specialist from the Project Management Team for Primary Care. She will discuss PhilHealth's Consulta Primary Care Benefit Package. Ms. Ana, are you here? Okay.
Okay, good morning, everyone. I will now share my slides. Mhm. Ah. Saan ba? Ito, okay. Okay, good morning, everyone. Sorry. I will be discussing sorry lang po.
Miss Hannah, are you online pa rin po? No, wala siya. Yes. Yes. I think you can proceed na po, Miss Anna.
Okay, good morning to everyone. Apologies for sharing yung ibang PowerPoint presentation. However, I would like to request for your permission na I will turn off po muna my video. Okay po. So, thank you. So, good morning to
Hello.
everyone.
Sige, go ahead po.
I would also like to extend my appreciation for inviting PhilHealth po to this activity. So I will discuss about PhilHealth's primary care benefit. Pardon lang po, mukhang ba't ayaw lumipat po ng aking slide. Can I request po the organizer to share my slides na lang po? I sent it this morning. Okay lang po.
Sige, ma'am. We'll check your, you sent it via email, ma'am?
Yes, ma'am. I
Okay.
sent it to Sir Ralph this morning
Okay,
po.
ma'am. Sige po. We can now present your PowerPoint, ma'am. You can go ahead po with your speech.
Okay. Ayan, okay. So, primary care. So we all know that PhilHealth or the UHC law was passed last 2019. So, the salient parts of UHC law, ayan po, makikita natin sa screen. That every Filipino shall be granted immediate eligibility and access to preventive, promotive, curative, rehabilitative, and palliative care for medical, dental, mental, and emergency health services. So, ang mga importante po dyan, primary care, like PhilHealth po shall provide a set of individual-based entitlements, which includes primary care, medicines, diagnostics, and laboratory. And makikita rin po natin sa dulo that every Filipino shall register with a public or private primary care provider of choice. Next slide. So PhilHealth is now expanding access to primary care. In the past po kasi, limited lang po ang membership category ng ating primary care. Nung una po, sponsored members lang po, employed members, but now, PhilHealth Consulta to all Filipinos na po. And it is also a previous slide lang po. Ayan. So, as you will see, it is a transitory benefit towards the achievement of a comprehensive outpatient benefit benefit which is stated po under the UHC. So we are expanding access to primary care. Next, please. So who are eligible? So as I have mentioned earlier, all Filipinos and other qualified PhilHealth beneficiaries. Next slide, please. So what are the services? So ayan po. Services, laboratories, and medicines. As to services, initial and follow-up consultation with the primary care provider, targeted health risk screening and assessment. And we also improve the primary care package by offering 13 laboratories and diagnostic services. Pati rin po ang medicines, dinagdagan po natin, 21 na po. Next, please. So, ayan po. So, the drugs and medicines based on doctor's prescriptions. So, as you can see in the slides, meron po tayong medicines for antimicrobial, anti-asthma, fluids and electrolytes, anti-diabetic, and po, anti-hypertensive, and so forth. Okay, next slide po. So the next question is how to avail. So una po, it is important that the consulta beneficiary is registered to a consulta package provider. So as you will see in the slide, meron po tayong tinatawag na self-registration through our PhilHealth website. Pumunta lang po tayo sa online services. Meron po doon member portal which is similar to opening an account in Facebook. Kasi po, magtatanong po ng security questions and most importantly, kailangan alam po natin ang ating PIN or PhilHealth Identification Number or what we call assisted registration, where we can visit the nearest PhilHealth Local Health Insurance Office or LGUs and other authorized third party. So once registered, we can now visit our chosen provider. And yun po ang tinatawag naming first patient encounter. So it is important that after registration, we will visit po our chosen KPP or consulta package provider. So during first patient encounter, our KPP will ask po basic questions about our health, yun po. So obtain health data, profile, and assess risk. So during first patient encounter and other succeeding consultations, we are requiring authorization transaction code. Or, if this is not available, pwede naman po sa mismong facility, tayo po ay kukuhanan ng picture or face capture ng ating KPP. So, yun pong authorization transaction code, pwede po yung i-request sa aming LIO. And if hindi po talaga available, then we can proceed directly to our KPP and we will sign a photo consent form. Yun po. So, kukuhanan po tayo ng litra. So, next naman po, after first patient encounter, i-assess po tayo ng ating provider, primary care provider or physician if kailangan po natin bumalik after a month or after 6 months for our succeeding consultations. Yan. And at the same time, i-assess din po ng ating doktor kung kailangan po natin ng laboratories and medications. And consulta package also, kung ano lang po ang nasa package, yun lang po ang libre kung tayo po ay nakarehistro sa isang pampublikong KPP. Pero kung halimbawa po, we choose to be registered in a private consulta package provider, meron po tayong tinatawag na co-payment cap of 500 pesos na sisingilin po sa atin ng ating private KPP, which is good for 1 year na po. So, 500 co-payment. Pero kung sa public KPP po tayo magpaparehistro, wala po yang bayad. Okay, next po. So, where to avail, you may type or click this link. Yan po. So, yan pong website na yan. Diyan po list down all accredited consultant package providers nationwide. Next, please. Next slide. Oh, yun po. So, thank you for listening. So, magparehistro na po tayo at magpakonsulta. Thank you.
All right. Thank you very much, Miss Ana Liza Pastrana de Leon. And now, to provide the World Health Organization's perspective on addressing the challenges to eliminate hepatitis by 2030, let us all welcome Dr. Kiyohiko Izumi, Technical Officer for Viral Hepatitis of the WHO's Western Pacific Regional Office. He is also joining us virtually via Zoom. Dr. Izumi, are you
Hello.
online? Okay.
Can I hear me?
Yes,
can you
sir,
hear
we
me?
can hear you. Go ahead.
Okay. Thank you so much. So, thank you so much for your kind invitation. I will share my screen. Let me try. Can you see my screen?
Yes, we can see your screen, sir.
Now, presenter mode? Okay,
Yes.
presentation.
Go ahead. You can.
Yeah, thank you. Thank you so much for your kind invitation. My name is Kiyo from WHO Western Pacific Regional Office based in Manila, Philippines. I'm going to talk about the addressing the challenges to the elimination hepatitis by 2030 and also some contents of the WHO technical guideline which was published recently. In 2016, the World Health Assembly adopted the Global Health Sector Strategy 2016 to 2021 on the viral hepatitis. It is for the first time called for the elimination of the viral hepatitis B and C infection as a public health threat by 2030. So it defined the elimination goals as a 90% reduction in incidence and 65% reduction in mortality of the hepatitis B and C compared to the 2015 baseline. So this is our target and goal. So the subsequent global health sector strategy covering 2022 to 2030 brought together HIV, viral hepatitis, and STI elimination goals into one strategies. So this is a kind of the integrated strategy covering 3 different groups of the disease. But based on the similarity, we provide the integrated interventions. So the strategy defines absolute impact targets and the programmatic targets for 2025 milestone target and 2030 elimination target, and provides a foundation for criteria for the country validation of the elimination and path to elimination. So here is some statistics. So 354 million people living with the Hep B or Hep C globally. You can see the figure. But if you look at the regional statistics, you can see the green part, which is Western Pacific region, where the Philippines belonging. So of the 354 million people living with Hep B or Hep C, 35% of them living in our region. So this means our region has a huge burden of the hepatitis B and C. So how about the service coverage? Since we have a huge disease burden, so we need to take the broader action on the prevention, screening, and the treatment and the care. So this is the viral hepatitis care cascade in our region. The green bar represents global value. Blue one is our region, Western Pacific regional value, and the gray bar shows you the WHO target by 2030. For hepatitis B birth dose vaccination coverage, our region already achieved 86%, which is very close to WHO target of the 90% by 2030. So we are doing good job at this moment as a regional value. Different country has a different statistics, but I am talking about the regional average. So for hepatitis B, 3-dose vaccination coverage, our region also showed a very high achievement with 95% of the vaccination, 3-dose vaccination coverage, which already achieved the WHO target. However, the hepatitis B diagnostic coverage is still very low at the 23%, and hepatitis B treatment coverage is also very low at the 15%. So if you look at the hepatitis C, so Hep C service coverage is also challenging, low coverage of diagnosis and treatments. So this means that these gaps are the unreached population by the service coverage. So this highlights further efforts needed to improve service coverage for hepatitis, especially diagnosis and treatment. So here is a key strategic shift is needed for elimination of viral hepatitis B and C as a public health threat by 2030. So here is some key components to do this. First, we need to have a greater public awareness of the importance of the viral hepatitis on prevention, testing, and treatment, and increase financial resources allocated in each country, scale up of the universal access to the hepatitis B vaccine, and improved services for prevention of vertical transmission, continuous investment in the primary prevention, including harm reduction and blood safety, greater increased access to the hepatitis B and C virus test and treatment. And to do so, we need to have a simplified and decentralized services as well as integrated service delivery. And of course, the community and civil society is a key partner and a role in our hepatitis control activity. And then lastly, research and development of the curative drug regimen, especially for the hepatitis B virus, is very important. In 2022, WHO published new WHO guidelines on hepatitis C. It provided the evidence-based new recommendations. So these mainly include the simplified service delivery, such as decentralization, integration, and task sharing, and hepatitis C diagnostics, such as a point-of-care viral load and reflex viral load testing. And the guideline also provide evidence-based recommendation for the treatment of the adolescent and the children. So here is a series of the WHO guidelines on the hepatitis C towards the simplified hepatitis C service delivery. In 2022, the right side hand, the column is the latest guideline. So the new guideline recommended treating all without genotyping and recommending to use pan-genotypic DAAs with 3 options. So this is simpler than before. And this simplified treatment is recommended for adults, adolescents, and children by a simplified service delivery model through decentralization and integration and task sharing. For the hepatitis C testing and diagnosis, so 2017 guideline, which is the one previous guideline also recommended two testing approaches, including focused testing for most affected population, including those with a clinical suspicious of the chronic viral hepatitis, family members, and sexual partners, and healthcare workers. General population testing is a second group in high or intermediate burden countries based on the hepatitis C antibody prevalences. And how to test? This guideline recommends a single serologic assay and linkage to the care and confirmation of the hepatitis C viremic by laboratory-based NAT or core HCV antigen assay. To promote uptake and linkage to the care, guideline also recommends to use dried blood sample specimens transportation for virology and serology and on-site rapid diagnostic test for the same day result feedback. So this recommendation is still valid, but in 2021 and 2022 updates, new guideline also added some recommendation, including hepatitis C self-testing and the use of the point-of-care RNA testing for detection of the viremia and for the test of the cure. So that's the we can expand the access to those tests through the self-testing and point-of-care. And also, the guideline recommend the reflex viral load testing. This can be achieved either through laboratory-based reflex RNA testing using specimen which was already held in the laboratory, or clinic-based reflex testing in the facility through immediate specimen collection after the confirmation of positive antibody by rapid diagnostics test. So the new guideline also highlighted community value and the preferences for the service delivery. Based on the literature review and key informal interview, 45% of the community-based organizations and general practitioner clinics prefer the viral load tests outside of the hospital. And more than 88% would like to conduct the initial and confirmatory test on the same day and same place. And 85% would like to start treatment on the same day if they had a positive viral load test result. And 92% would like to be tested and treated in the same place. So this highlighted for us to think more simplified and integrated approach in the service delivery point. I would also like to talk about the WHO guidelines on the elimination of the hepatitis. To support country validation of elimination of viral hepatitis B and C, WHO released guidelines last year. So this guideline highlighted the criteria for the country, show their statistics to get the validation of the hepatitis B and C elimination as a public health threat. So here is a several category of the criteria. First category is epidemiological indicators, like for the hepatitis B, incidence needs to reduce 95% from 2015 baseline, and mortality 65% reduction. For the hepatitis C, incidence should be reduced by 80%, mortality 65% reduction from 2015 baseline. Addition to those epidemiological indicator, for the hepatitis B, which has also another indicator like a viral hepatitis, elimination of the mother-to-child transmission. So the criteria is HBsAg prevalence in less than 5 years old should be less than 0.1%, and annual mortality less than 6 per 100,000. For hepatitis C, annual incidence less than 5 per 100,000. Among PWID, high-risk population, less than 2%. And the annual mortality for the hepatitis C, combined hepatitis B and C mortality should be less than 6 per 100,000. So these are the kind of impact indicator, epidemiological indicator that the country needs to achieve to be certified by the WHO as the elimination of the hepatitis B and C as a public health threat. In addition to the impact indicator, the country also needs to show the programmatic target, like this is a vaccination coverage and testing coverage. And among the test positive, they need to show the a high treatment coverage. For the hepatitis C, they also need to show the testing coverage and the treatment coverage. And there another indicator for the prevention, 100% safe injections and the blood safety, and so on. So here is the 4 types of the options for the validation of the elimination. The first option is that country can show the statistics to achieve the elimination of the mother-to-child transmission of the hepatitis B infection. And the option option 2 is hepatitis B elimination as a public health threat, and hepatitis C elimination as a public health problem is a third option. And the different option has a different combination of the criteria that I showed in the previous slide. And the fourth option is elimination of the both hepatitis B, including EMTCT, and hepatitis C as a public health problem. So the option 4 should cover all criteria that I showed in the previous slide. So for the high hepatitis burden countries, WHO also set the path to elimination. The process for the path to elimination is the same as for the food validation, but with a different criteria for process targets and impact targets like incidence or mortality are not required for this path to elimination certificate. So WHO set the bronze tier, silver tier, and the gold tier, and each tier has a bit different criteria for the service coverage. So that's dependent on the country. So some country can achieve the bronze because they still improving their service coverage, but some country can achieve the gold. And then these certification can push the country toward the elimination, which means the food validation. So I stop here. So I hope you get the some valuable information from my slide presentation. Thank you so much.
All right, thank you very much, Dr. Kiyo Izumi. Sir, Dr. Kiyo, I was informed that, are you still there? That you will no longer be able to join the panel discussion, but allow me to ask just one quick question. Doctor, are you still with us? Dr. Kiyo? Or did he leave already? Oh, he's still there. Dr. Kiyo, can you still hear me?
Sorry. Yeah,
Okay.
I'm here still.
Just one quick question, sir. Sir, are there initiatives or perhaps best practices against viral hepatitis and liver cancer in the Western Pacific region that have shown promising outcomes that the Philippines perhaps can follow or learn from, as an example?
Mm-hmm. Yeah, thank you so much for your questions. So most of all of the country in our region is trying to, achieve the control and elimination of the viral hepatitis B and C. But of course, depend on the country. Each country has a different, progress and different circumstances in terms of the resources and disease burden. But one of the country like Mongolia in our region, Mongolia have the very high prevalence of the hepatitis B and C. And the Mongolian government developed the plan of the health liver program. So this is one of the best practice in our region to control the viral hepatitis. So Mongolia has implemented a comprehensive national program addressing hepatitis. They focus on the widespread screening. Among the general population over 40 years old, so that they provided a screening, mass screening in the population level. And then they promote the vaccination, high vaccination coverage among the children, and also screening of the pregnant women. And once they find the test positive, they smoothly link them to the diagnostics and treatment and the care. So they ensure the access to the affordable treatment. So the program has significantly reduced hepatitis prevalence and can serve as a model for other countries. Over.
Okay, thank you very much, Dr. Kiyo Izumi. Let's give him a round of applause again, please.
Thanks so much.
Okay. We received a very special message from the Department of Health, Secretary Teodoro Herbosa. We are very privileged to have that, and we will play his message for everyone who's here today in the event. Let's listen to Secretary Herbosa.
To Statistics ADRi Institute President Mr. Victor address Manhit and his staff, Yellow Warrior Society Philippines, Asia Pacific Liver Alliance, Universal Healthcare Watch, esteemed guests, ladies and gentlemen, and to everyone present to all, a healthy Pilipinas to all of you. On behalf of the Department of Health, I am honored to speak before you on this momentous event with the title, From Awareness to Action, Empowering Stakeholders for Better Liver Care. January marks the annual observance of Liver Cancer and Viral Hepatitis Awareness Prevention Month in the country. As we gather today, it is crucial to address the pressing issues related to liver diseases. In the Philippines, liver diseases accounted for 27.3 cases per 1,000 deaths in 2020. Among liver-related deaths, 32% are due to liver cirrhosis, 35% are due to liver cancer, and 5% are from viral hepatitis. Hepatitis B remains highly endemic in the Philippines, with around 1 out of 10 adult Filipinos affected. Chronic hepatitis infection, along with alcoholic and non-alcoholic fatty liver diseases, are the major risk factors of liver cancer. Based on the 2020 Adult Cancer Report, liver cancer is among the cancers with the highest morbidity and mortality in the Philippines, with a total of 10,594 new cases. For the next 5 years, the health sector is guided by the 8-point action agenda, and with the aim to make universal healthcare a tangible reality for every Filipino, ensuring equitable access to quality and affordable healthcare and protection against financial risk. In our commitment to address liver cancer and other cancers, the Department of Health has lobbied for concrete legislative solutions and implemented comprehensive cancer programs. Our endeavor covered the end-to-end spectrum of care with strong emphasis on health promotion and disease prevention. We have implemented strategies such as improving hepatitis B vaccination, expanding regular screening and early detection efforts, encouraging healthy lifestyle choices, managing needle-stick injuries among health workers, and strengthening substance abuse and use control. In line with this, our mission is clear: from raising awareness to fostering preventive measures and providing compassionate palliative care, we are dedicated to empowering stakeholders, for better liver care. Research and development from the cornerstone of our efforts to combat liver diseases. Stakeholders contribute invaluable expertise and perspectives that enrich the understanding of these diseases. Your involvement catalyzes breakthroughs and ensures that the fruits of research collaborations reach those in need. As we navigate the complexities of liver cancer and viral hepatitis, let our commitment to collaboration and shared responsibility be our guiding principle. Through the empowerment of stakeholders, we have the opportunity to transform awareness into impactful action, making strides towards a future where liver diseases are not just understood, but actively managed and ultimately prevented. May this event be a catalyst for transformative discussions as we chart a course for a healthier nation dahil sa bagong Pilipinas, bawat buhay ay mahalaga. Maraming salamat po sa inyong lahat.
Panel discussion. So may I invite again on stage Dr. Jen Agkawili Conde and Mr. Vincent Sumergido. I think Miss Ana Liza Pastrana de Leon is still with us online. Miss Ana, are you still here?
Yes,
Okay.
yes, ma'am.
Okay, ma'am. We'll ask you a question po later on. And we are already 30 minutes over time, so we'll try to keep this as quick as possible, but still very informative pa rin po. Okay? Siguro let me ask first, although you both can answer this question naman. My first question is, what are the unique challenges and barriers po ba and advancements na rin in the country regarding addressing viral hepatitis and liver cancers? Ano ba yung pinaka-struggle para sa atin to address these liver diseases?
Okay, as doctors, probably yung awareness, no? So that's why, ayan, okay, so awareness, kasi, ayun, yung education, no, ng mga patients. So that's why, yun, that's why there's yung nga yung stigmatization, they feel discriminated, and then yung mga yung mga do's and don'ts ng mga patients na may hepatitis B. Kasi based on experience, no, I've encountered a lot of patients pa rin na pag may Hep B, bawal daw hawakan, maghalikan, hinihiwalay yung baso, yung plato, yung kutsara, yung tinidor. So that's why we as doctors, no, we're trying to educate, no, our patients, and not only our patients, we work hand in hand also with other doctors to also be educated na hindi nakakahawa ang hepatitis B ng ganun-ganun lang. No? So I think it's more of empowering and educating all of us, no, with regards to this kind of diseases, most especially hepatitis B and liver cancer.
Sir Vincent?
Thank you, Doc. Yeah, so coming from the perspective of the government and prevention and early screening, I think one of the challenges is to make sure that screening and early detection are integrated in all parts of our sector. Kasi sinasabi ko kanina, when we want to fight this disease, it's not just about the health sector or the work of the doctors to address this, but it would take the whole of nation, the whole of society approach. So we know na doing this it's really challenging kasi you have to stitch all the government agencies, the private sector, diba, to really pour in their resources on this one. Kasi that's the only strategy na very, very critical right now, is to make sure that the screening, prevention, and early detection services are available on the ground, accessible, and at the same time affordable for all the Filipino natin.
Yes, sabi nga rin kanina, diba, in the previous panel, the problem really is awareness. And I think it's also I'm not sure if it's a Filipino thing or if it's just human nature na yung takot magpa-check up. Kasi pag nagpa-check up ka, ang daming kung ano-anong sakit lalabas, diba? And syempre, binanggit nyo nga kanina, economic reasons, diba? Hindi naman, una, mahal magpa-check up at mas mahal magpagamot. Pero ang hindi natin kasi nare-realize, kapag nakita ng mas maaga ang sakit, mas technically makakatipid pa tayo. Kasi mas mahal yun kapag komplikado na yung sakit, di ba? But in so far as economic concerns or economic issues is concerned, di na mabanggit nyo kanina, sir, na sa pagpa-provide ng mga gamot, especially in terms of cancer, 20 to 22% lang yata yung nabibigyan natin and nauubos kagad. Paano kapag merong lumapit nang hingi ng gamot pero ubos na? Posible ba yung mga ganon? Ano yung mga iba pang remedies? Ano pang pwedeng gawin?
Okay. So the slide that I have earlier, the 20 to 22% is actually the DOH procured cancer medicines. Pero outside that, there are also other financing intervention. Yung sinasabi ko kanina na malasakit natin, di ba? So that can also fund for this and the cancer assistance fund. The kulatilla in there is that as long as the service or the medicine is in the hospital, andun po siya sa pharmacy ng hospital, meaning local procurement po yan, binili po yan ng hospital. Pero ang magbabayad po niyan is the Cancer Assistance Fund or the malasakit program namin. So the patient can avail that. So and then there are also other things. DSWD can also provide, I think they have their program, yung AIX, yung assistance for basta for individuals in crisis, something like that. So there are a lot of government interventions then outside the usual procurement that we have.
Go ahead, ma'am.
Yeah, besides from the government, there are also, I think, in the private sector that could also help, no? So from our pharma industry, they do have this like programs such as compassionate use of their medicine. So that could also help our patients with liver cancer.
Pasok ako sa PhilHealth kay Ms. Annalisa. Ma'am, how can we ensure na fully utilize ng mga pasyente natin yung mga benefits na nararapat para sa kanila under the programs of PhilHealth po? And how can we also help enhance the awareness of the benefits that the patients can avail of po? Ms. Annalisa. Ma'am, are you still with us po? Online pa siya. Miss Annalisa. Okay,
I-unmute ko na po. Okay.
Okay.
On the part of PhilHealth po, we encourage our potential primary care providers. Example po yung clinics or yung mga big companies na meron pong clinic mismo sa kanilang like Meralco. Yan po. May sarili po silang clinic na to be consulta accredited po. Ayun po. To be accredited. As long as they will pass the accreditation standards for consulta, then yun po. Kasi, for example po, yung isang company, may clinic sila. Of course, yung mga empleyado po mismo nila can avail of the benefit. And not only their employees, but also their dependents, spouse, children. And in terms of awareness naman po, sa ngayon po, meron pong pinaplano ang PhilHealth na caravan nationwide po. And to bring consulta package closer po sa ating closer to Filipino people, not only po sa ating mga, not only dito sa city, but also we are looking at the community level. Over.
Apo. Ms. Annalisa, kasi di ba laboratory testing is one of the main concerns po in treating viral hepatitis. And ang narinig rin po natin, kailangan pa daw po lumapit ng mga pasyente sa malasakit center or sa MAIP, Medical Assistance for Indigent Patients ng mga LGUs nila. Meron po bang plano ang PhilHealth na gumawa ng viral hepatitis benefit package? Or meron kayang magawa ang mga patient advocates natin para mas mapadali ang proseso para sa mga pasyente po natin?
Okay. So currently po, ang PhilHealth offers po ay yung inpatient benefit po under all case rates. Then for the outpatient, tulad nga po ng comprehensive outpatient benefit package. So perhaps yun po, doon po natin pwedeng maisama yung um, diagnostic or laboratory test for hepatitis.
Okay. Would you like to add something po?
Sige, maybe I can add, no?
Sige,
I think that's one of the strategy right now of the intergovernment, no? Kasi PhilHealth is trying to direct the resources in terms of primary care. Kasi di ba dati parang ang hirap magpa-check up kasi it's not accessible, parang you don't know what to do, di ba? Pero the wisdom in there is making sure that these consulta services are available on the ground. Paglabas mo ng bahay, andyan lang yung provider mo, and it's for free para and then you could already be checked. And if you notice yung services kaninang PhilHealth sa konsulta, it's parang generic, di ba? Parang sabihin mo na ay parang basic lang yan. Pero that's where actually early intervention starts. You check the patient generally, and then pag may na-detect na siya na something medyo may kakaibahan dito, that could already be referred to the next line, yung either physician natin or the next level of care, so that early intervention can be provided. So I think there's also some challenges din, no? Kasi all the while we think na PhilHealth will provide everything and blah blah blah, pero we also have to understand in the bigger perspective na it's not only hepatitis yung tinitignan ng PhilHealth to finance. There are also other diseases na nasa top 10 morbidity and mortality natin. Kaya the intervention of the government is, while PhilHealth is working towards expanding their benefit packages towards primary care, yung consult services nila, and the outpatient nila na mga benefit packages, the other sectors of the government also comes in terms of providing support. So that's why the DOH also gives yung mga free augmentation natin for screening for pregnant mothers and also for the treatment of antivirals. Pero that's not just only that, no? Pero there's also may role din kasi yung other sectors. For example, the Department of Interior and Local Government. Kasi the provision of services, yung screening natin, vaccination for infants, for example, these are some of the devolved services on the ground. So basically, it's if the LGU has a lot of resources, for example, they could channel that to that kind of intervention. So that's also one challenge actually, na how can we align all of that to make sure that the priority diseases are also funded and prioritized by local government units.
Actually, on that note, sir, meron, you mentioned the local government, no? We have members, representatives from the different local government units here with us today, starting with from Taguig LGU, we have Dr. Maria Lizelle Ramos. She is here with us right now. Sige po, mamaya po magtatanong ako sa inyo. Baka po you can share something din, mga best practices natin sa Taguig. Also with us today is, hold on, ayan. Okay, wala ang listahan ko, ayan. We also have from Tala Hospital, si Nurse Ceres Amor Tagalog, and also Miss Maria Nemia Yap. Ayan. We also have from social hygiene, Dr. Arlene Sanchez. There's Dr. Arlene. And from the Stitch Project, we also have Dr. Janus Ong. Saan po si Dr. Janus Ong? Oh, there is, sir. Okay, siguro I have a quick question po, no, for Dr. Lizelle. Ma'am, what do you think of the discussion? Would you like to share something po? Maybe you can share your experience in Taguig, especially in dealing with persons with liver diseases po. How are we helping them?
Yes, for Taguig City. So, first of all, na-devolve na yung mga gamot, vaccine, and test kit. So, sa tulong ng government ng Taguig, na supplyan natin yung mga pangangailangan ng mga Taguigenyo. At the same time, gusto natin ma-raise lahat po ng mga tao sa Taguig, yung ma-reach sa bawat sulok ng Taguig, yung awareness regarding sa hepatitis B. So yun po.
Sige po. Maybe si Ms. Ceres or Ms. Nems po from Tala Hospital can also share some of your best practices po. Paano tayo nakakatulong sa patients po?
Tatayo siguro ko kasi mukha akong nakalubog. Okay, so sa Tala Hospital o Dr. Jose Rodriguez Memorial Hospital, nag-start kami ng pag-cater ng mga ng hepatitis B patients during 2020, pero since nagkaroon nga ng COVID at na-convert yung hospital namin noon into a COVID hospital, so medyo na-stop. This year, or 2023, yes, doon kami para nag-start talaga na mag-accept talaga ng mga patients na. So, ang best practices namin is, number one, ngayon kasi medyo nag-start na kami na ipasa na namin sa gastro department yung mga consultations. And available din yung aming treatment, yung tenofovir. And syempre, yung mga laboratory that needs ng patients namin, yung may baseline, available lahat naman sa amin yan. We were able to provide HBV DNA. And lahat ito ay nailalapit sa malasakit. We have malasakit in the hospital. And ini-start na namin ngayon na ma-in place yung program. Siyempre, kay Ma'am Ceres, kasi siya yung nurse ng gastro clinic. Ang hawak ko kasi ay HIV. Nung start kasi, pinasok yan sa amin. Oo, sa HIV, AIDS, Hep B treatment. Now, pinapasa ko kay Ma'am Ceres. So since kakapapasa ko pa lang, medyo baka matrauma si Ma'am, kaya ako muna ulit nandito. But then, ina-accept naman namin kahit saan ang galing yung mga patients. No? May number ako sa Yellow Warrior. They can always ask my number. Kasi prior makapunta doon, at least makontak muna ako kasi baka may mga kakailanganin. So yun yung masasabi namin na nakasupport naman kami when it comes to Hep B treatment, consultations, and itong program na to. Hopefully, with the partnership with the Yellow Warrior, no, magkakaroon kami ng mas magandang program in the coming years. Thank you.
Okay. And we'll look forward to that po, ma'am, no? Isa pa is yung social hygiene facility, si Dr. Arlene. Ma'am, baka you can share what are the diagnostic tests po. Since social hygiene facility, you offer diagnostic tests po. What are those that are available po in your facility? And kung kailangan din po ng tulong ng mga pasyente, ano po ang maaari nating maitulong sa kanila?
Hi, may I correct? It's Caloocan Social Hygiene. So, yes, we are helping patients with hepatitis. And initially, we screen also. So, we distribute all our hepatitis B surface antigens to all our 44 health centers. This way, we can do screening, not just to pregnant women, but for those who have concerns regarding other liver problem. So, as long as the patient is willing, just like HIV, so we do confidentiality. We ask them first for their consent, and if they're willing, we do the test. And like yesterday, we did an inspection of one resto bar. So it so happened that 2 tested reactive with Hep B surface antigen. So we had to advise them discreetly to just visit us in our center so that they will not have the stigma of suffering from their co-employees in the same resto bar. This way, we maintain their confidentiality and we maintain the good relationship so that they will trust us to deliver the further test and referral to a hepatologist or a gastroenterologist. And also, we are pleased to announce that we're one of the recipients of the tenofovir, which we distribute which came from Yellow Warriors, and we distribute to all affected with hepatitis all over the Philippines. So we ship out from north to south as far as Mindanao. And by the way, Dr. Conde, may I just ask, from one patient in the south, she was asking because 2 family members died because of liver-related disease. But then she only had hepatitis B surface antigen, but was started right away with tenofovir. So is this okay to practice? Or do we have, because I know you have to do series of diagnostic tests first before you start on the medication. However, the internist who checked on the patient already prescribed the tenofovir. May I just clarify if that is okay, or if she will be tested first and then resume or stop?
Okay.
Thank you, Doc.
Thank you, ma'am. Okay. So, for that patient, no, okay. So there are a lot of different guidelines that deals with in treatment and diagnosis of patients with hepatitis B. No, so we have in European, we have the Asian, and locally the APASA, the Asia Pacific, and also here in the country we have the HSP guideline. And also, we also have the WHO guideline, no? So, with regards to that patient, case-to-case basis po, ma'am, no? Kasi if there's really a high risk, no, of the patient, for example, family members who died of liver cancer because of, or liver cirrhosis because of hepatitis B, I think that's the main indication why the internist started him right away for antiviral treatment, no? So okay lang 'yon, no? Kasi there are some naman that's the yun nga, yung mga different guidelines would have different indications. Some patients would be started, not all patients with Hep B will start right away on antiviral tablets such as the tenofovir and the entecavir. Kung may ongoing inflammation in the liver or elevated SGPT, that's the time na, or minsan, pag mataas yung HBV viral load, depende pa rin kung may e-antigen positivity siya or e-antigen negative. So minsan, pag ganun, pag mataas, more than 2,000 for e-antigen negative, elevated SGPT, that's the time we start on treatment. There are some naman, pag e-antigen positive, then elevated SGPT, more than 20,000 viral load, that's the time we start treatment. Pero meron yung mga tinatawag na inactive carriers, ALTs, or the SGPTs are normal, then mababa lang yung viral load, we just monitor them either every 3 months or 6 months. So not all, no? There are some advocates naman, if you will hear from na meron sa ibang bansa, treat all. Basta nag-positive for HBsag, bibigyan na kagad ng gamot. However, yun pa, hindi pa namin siya ina-adapt kasi we need further studies with regards on that. Kasi as we know, hindi naman sa yun din, here in our country, it's out of pocket, no? Tayong bumibili ng gamot, no? Unlike in other countries, kasi yung government nila, yung kayang mag-supply ng gamot. Kaya, they can give them medication. Eh, syempre sa atin, kung mag-start ka early ng gamot, syempre usually lifetime na yon, no? So, magkano rin yon? Around 50 pesos to 150 pesos in a day. Eh, magkano yung sinusweldo nating mga Pilipino, di ba? Kaya ba natin yun i-sustain lifetime? Kung ako, hindi naman sa basurero, mas gusto kong pambili ko na lang ng gamot, ay pagkain ng anak ko kaysa pambili ko ng gamot. So that's why we're still looking on that strategy, no? There are ongoing studies with regards to that kind of strategy of treat all, pero hindi pa ngayon. Yes.
I think Ms. Annalisa would also like to answer the question po. Ms. Annalisa?
Actually, it's not a question. I would like to clear lang po na if you are registered to a public consulta package provider, it's free po. Pero pag sa private, meron po tayong tinatawag na co-payment cap of 500 pesos. Yun lang po. Over.
Okay, thank you. And we have one more group kanina. It's so nice to know, di ba, na aside sa government, meron din from private sector and civil society organizations na tumutulong sa mga persons with liver diseases. And one of them is the Stitch Project. We have Dr. Janus Ong with us today. Dr. Janus, baka you can talk about what the project is about and how you are helping patients po.
Thank you for inviting us. And my name is Janus Ong. I think some of the members would know me. But I'd like to just hand over the microphone to our program manager. He knows this more than I do. Of course, I know about it. But and then I can answer some of the other questions that you may have as well. Yeah.
Sige po. Thank you po. Good morning to everyone. Manu po, no? And sa Stitch project, we started with a baseline assessment last year. And karamihan po ng mga shinare nyo, nakita din namin sa Tarlac. For example, awareness is low, accessibility is low, affordability is low, masyadong mahal, malayo health center, etc. So, karamihan po nito long-standing challenges talaga, no? And kaya natin ginawa yung Stitch project is to answer those long-standing problems na essentially systemic talaga and provide systemic solutions through what we call a model of care. So itong model of care po na ginagawa natin sa Tarlac is a package of interventions. At pag sinabi natin package, ibig sabihin sabay-sabay po natin siyang ini-implement in a way na hindi siya patse-patse. Na from screening, papunta sa confirmatory testing, treatment eligibility, hanggang monitoring. Tinutulungan po natin yung facilities, yung mga patients, as well as yung mga decision makers dun sa province of Tarlac to better provide hepatitis care, no? Kasi ang pinaka-objective po ng Stitch project is to magbigay ng the right hepatitis care at the right time at the right place. So yun po.
Thank you for that. I think at this point we can accept questions from the audience. Meron po bang gustong magtanong? Okay, wala na po tayong katanungan. Okay, sir, sige po. Okay, and then balikan ko kayo, ma'am, pagkatapos po na, sir.
Regarding sa government, pagdating po sa pagbibigay ng free service to the mga kapareho nating merong pinagdadaanan, no? Kasi hindi naman lahat kasi na nagtitreat with gamot. Merong mga monitoring. With regards to PhilHealth, kasi katulad niya, sabihin natin yung dialysis, kasi pang lifetime siya eh. The PhilHealth, meron siyang dialysis packages. How about for sa Hep B or HIV? Parang wala siyang nakikitang ganun na, kasi lifetime siya eh. Hindi naman siya yung treated now, wala na later. Parang wala akong nakita kasing mga packages with regards to that. Does the government, with the help of ng mga hepatologists na makapag-create ng ganung packages, especially sa monitoring, kasi katulad ko, monitoring, pero wala pang gamot. One of the medyo mahal talaga yung HBV DNA. So, meron bang plan or lahat dadaan sa malasakit or sa support? Pero dapat kasi ang meron sanang inclusive siya na through sa PhilHealth. Parang ganun.
Okay. Thank you, sir. Miss Annalisa, would you like to answer po?
Medyo mahina lang po yung audio ko dito. Pero ang nais po ba ni sir if may plans ang PhilHealth to develop a benefit package for hepatitis? Tama
Yes
po
po,
ba?
tama po.
Okay. So, yun na po. Sa ngayon ay inpatient lang po tayo for for hepatitis or yung mga cases po na may HEPA. Inpatient lang po tayo sa ngayon, but yun pong screening or diagnostic services for testing po, maybe included po sa ating comprehensive outpatient benefit package. And yun nga po, I would like to add din po na ang mga benefit packages po ng PhilHealth, dumadaan din po yan sa masusing pag-aaral, yung nabanggit po ni Doc kanina, burden of disease, yan po. May mga basis po tayo kung bakit meron din po tayo tinatawag na yung prioritization, yung benefit plan, yan po. Para po magkaroon po tayo ng mga benefit packages. Over.
Sige. Maybe I can add siguro a different or just to give a perspective na Kasi the PhilHealth right now, the role of PhilHealth as the strategic purchaser of health in universal healthcare is directed towards early prevention, parang primary care. Kaya kung nakikita po ninyo, much of their effort are towards ensuring na lahat ng Pilipino meron siyang konsulta provider and naka-register tayo para at the early stages, we can be detected. And pag may nakita na po doon sa screening pa lang, it can already be have interventions. So that's one. So that's also a limitation, no? Kasi pag disease specific, yan po yung medyo challenging din ngayon kasi sinasabi po natin kanina, it's not just only hepatitis ang tinitignan din ng PhilHealth to fund. There are also a lot of diseases. Kaya we need to look at that perspective na how can we strategically align our resources to have a bigger impact for all. Pero syempre, we don't say naman na, sige, hayaan na natin. Kaya there are also other, kumbaga, packages of intervention. So yung sinasabi ko kanina, yung malasakit center natin, yung na-mention kanina ng hospitals natin, kasi the malasakit center is actually broad. It can cover all diseases, okay? If you're admitted in the hospital, and as long as the services are inside the hospital, they can pay for that, okay? Diba? So that includes inpatient services and also outpatient services. So kung may mga medications, please correct me lang ma'am later on. Medications, for example, in the pharmacy, and then nakita ka ng OPD nila, and then you're assessed by the social worker as indigent or financially incapacitated. Kasi dati indigent lang, and not all are indigent naman, di ba? Pero once you have a debilitating disease or a lifelong disease such as hepatitis, and then makita na madami ka ng ginagastos, you can be actually tagged then as financially incapacitated. Kaya you can be also eligible for malasakit program, yung MAIP na funds na binibigay ng gobyerno natin. So that's one. The other is the Department of Health also provides augmentation. So kaya kasi ang main provider talaga ng services gamot are the local government units. Pero we know na not all local government units can buy the needs, di ba? So we also augment. Kaya we're also trying to increase that allocations. We have a lot of discussion with Dr. Janus. Nakita nila kung gaano lang kaliit ang nabibili namin, and they're always pushing us to give more. So that's one thing that we're also trying to look into. How can we find other sources? So for cancer naman, pag later on, pag lumala talaga siya, there's also other interventions for cancer. So yun lang po, no? Parang wala pa siyang one-stop shop for all, pero rest assured na there are actually different packages, and I think that's one thing also that we want to educate and make people aware na how can you access this. So it's really important kasi sometimes our doctors, yung private doctor, pupunta doon pasyente, so sometimes sabihin ng doctor, ito bilhin mo, so pagkita niya ang mahal-mahal na. Pero if the private doctor is also knowledgeable na you can access this, you can access that, so that patient can be actually navigated to these government interventions that are for free and can be accessible for all.
Thank you. Mahalaga pala talaga yung awareness, hindi lang sa mga pasyente, lalo na sa mga doktor. Kasi sila yung pwedeng mag-provide or mag-educate sa mga pasyente kung saan pa sila pwedeng makahingi ng tulong o suporta. May tanong pa po ba tayo? Sige po, siguro ito na po yung last kasi super overtime na tayo.
Regarding lang po dun sa mga program ng Malasakit Center, Caloocan Social Hygiene, saka Stitch Project, may listahan po ba to ng mga facility na pwede naming mapuntahan? Kasi parang ito nakinig ko lang sa tala. Paano po yung sa ibang location? Para naman mapuntahan namin if ever there's a benefits for us. Tapos regarding din po dun sa PhilHealth, kasi di ba screening po yung first, tapos may binanggit siyang diagnostic. Kaya lang yung regarding sa liver, yung primary diagnostic kasi ginagawa sa amin, ultrasound, saka SGPT, SGOT, yun nga, hindi siya kasama doon. Pero diagnostic test din siya na basic. Paano po kaya yun?
Okay po. So, thank you po sa feedback. Actually, yan pong consulta benefit natin dumaan din po sa costing, and we know na yan pong nabanggit ninyong laboratory or diagnostic services, medyo expensive po. So, but for this year po, we are planning to conduct po costing exercises para kung ano pa po yung pwedeng services na maidagdag po sa konsulta or eventually maidagdag po doon sa comprehensive outpatient benefit package na nakasaad nga po sa ating UHCO. So, doon po sa ating mga facilities po na nandyan, in case lang po, maimbitahan po kayo ng PhilHealth to participate in our costing survey. Sana po ay mag-participate din po tayo. Over.
Sige, quick lang siguro to connect with PhilHealth. Kasi PhilHealth is also looking, remember the Consulta package is a primary care package. So sa mga RHU po yan. So not all services are actually available. For example, ultrasound, it needs a machine, it needs a sonologist to read that. So maybe hindi siya probably appropriate for that. But they could have that MOA, okay, with a private facility. So these are the things na possible din actually to expand. So that's a good development, hearing from Ma'am Annalisa that they're doing that survey so that we could also improve the consulta packages that we have right now.
Okay, from the Caloocan Social Hygiene po, currently we are doing hepatitis B surface antigen testing. As I have mentioned, once non-reactive, you're automatically vaccinated with Hep B vaccine. And then for the test, if you are a Caloocan City resident, we have also yung mayor's assistance on top of everything else. So we also have, if we qualify you as indigent, then you also get the free test at yung mga other tests. Not all po. Yung viral load testing is not part of it yet. Pero po, nabibigyan po ng monetary equivalent, pandagdag, pabawas nyo man lang sa expense. So, our hospitals, the Caloocan City Medical Center and Caloocan City North Medical Centers, pag indigent po, medyo nabibigyan po yan ng consideration para makapagpa-test kayo ng libre. In fact, there was also before with our TB program, because I'm also in charge of One Health Center, may ka-tie-up din po kaming diagnostic clinic. My patient was very pleased kasi imbis na nagbayad siya ng 2,000 pesos, nakita daw yung pangalan ko dun sa in-stamp ko, naging 400 pesos na lang yung bill niya. So, those are for Caloocan City residents. Maybe it will be the same also for other LGUs, depende po sa kanilang mga program. Pero so far, I'm sure nagsusupport po. So, in Caloocan City na social hygiene, we don't just check on people from Caloocan. We don't limit patients na taga Caloocan lang po. You are all welcome to visit. So, we are in currently, na-relocate po kami ng konti. We are in the same new City Hall building, pero we moved up to Bulwagan, the right wing na number 2 po. So in case po na you need your family members to get tested for Hep B surface antigen, you can visit us po.
Thank you very much, Dr. Arlene. Maybe Dr. Janus, gusto niyo pong magdagdag?
So our project is in Tarlac, and it's a pilot project. So anybody in Tarlac, in fact, we encourage everyone in Tarlac to get tested. And so there are 3 sites po. That is the Moncada Rural Health Unit, and then the Concepcion Rural Health Units, and then the TPH Cares. So they can go to those sites to get tested. If they are positive and they need evaluation, they can also go to the sites to get the evaluation po. So yun yung sa Tarlac lang po yung demonstration project, unfortunately, no? So sa ngayon kasi yun po yung kaya yung model of care na tinitingnan, and hopefully nga po matulungan nyo kami na maging successful siya, kasi po doon i-cost po natin yung magkano yung from screening to diagnosis to testing to treatment and monitoring. Para po katrabaho din namin ng PhilHealth para ibibigay namin yung data or datos po sa kanila para po makapag-design ng package of interventions, either screening po, and then testing package, or isang buong package na lang kagaya ng HIV. So yun yung dream ang inaasam para talaga mapasok siya sa PhilHealth. Kasi nga alam naman natin na kapag mapasok, big ano na po yun, big victory for hepatitis. Pero Vince, yung sites ba na identify natin, functioning ba yun or yung binigay natin sa zero prevalence?
Yeah. So Dr. Janus was mentioning, there are actually, we did a survey kasi currently right now gumagawa ng zero prevalence survey nationwide ang team ni na Dr. Janus to identify ano ba talaga yung prevalence ng hepatitis sa buong Pilipinas kasi that's also one data that we don't have. So how can we cost the medicines that we need nationwide if we don't know the estimated prevalence, di ba? So that's one. So they're doing it, pero the question is, once they detect during the survey, anong gagawin natin dito? So we did a survey, kumbaga, collection of information sa ground, and then there are actually list of hospitals that provide us information that they can manage hepatitis, meaning it means that there is a doctor there, a specialist that knows the treatment. Second is there are available support and interventions such as medications, and then also yung malasakit centers natin. So I think that list can be shared also with our stakeholders so that if, for example, if you're nearby that, you can go into that facility, no? So I think that's one. Pero again, just expectation lang, no, to manage our expectation na syempre the resources are also limited. So sometimes pagpunta natin dito, ganito lang mabigay, something like that. So these are the things na syempre tinitignan din natin. Pero these sites are there to help, and then syempre the government will continue to provide the necessary support in order for them to improve better.
Okay, thank you very much. And unfortunately, that's all the time that we have for today. But once again, let's give our panelists, our guests, a round of applause, please. Yes, it's been a very insightful and informative morning. No? Marami tayong natutunan. And I'm sure marami pa tayong dapat pag-usapan. So after this, pwede tayong... sorry. Ayan. Okay, sorry. After yan, pwede tayo mag-usap-usap pa and connect with each other. Sabi nga kanina, it takes a whole of society to help address this issue. And on that note, pasasalamatan natin ang mga panelists natin. We have certificates of appreciation again for Dr. Jen, Sir Vince, and also I think Ms. Annalisa. Isa-send na lang natin sa kanya online. Okay? So, let's give them a round of applause, please. And let's have a photo opportunity. Okay. Okay, sige. So to wrap up today's discussion, we have Mr. Alvin Manalansan of Healthcare and Education Convener of the Citizen Watch Philippines, and he is also the co-convener of the UHC Watch, or the Universal Healthcare Watch, and a non-resident fellow at the Strat-based ADR Institute. Let's give him a round of applause, please.
So, good noon to everyone. We are now approaching the final part of our program. I know most of you are already quite exhausted from the lengthy but fruitful discussions, and now looking forward of what is for lunch. So, but kidding aside, let me start by going back to the theme of this event. From awareness to action, empowering stakeholders for better liver care. I hope this was tackled in the earlier discussion and will result in the achievement of having a better workplace environment for employees and support the goal of viral hepatitis elimination at the soonest possible time. So allow me to summarize few points from our respected speakers and panelists. In her keynote address, Senator Nancy Binay, who was represented by Ms. Carlene Yap Villa, expressed her better access to high-quality infection management required to achieve health goals, and she emphasized the importance of collaboration among public, private, and non-governmental providers, linking efforts with sexual and reproductive health, family planning, and adolescent health services, supporting public health initiatives, screening, diagnosis, and treatment for hepatitis B concentrated in the private sector. In the first session, Dr. Daryl Lucian Bautista mentioned the Department of Labor and Employment's initiated Labor Advisory Number 20, wherein cancer prevention and control in the workplace, which is a general guideline for cancer and of course for liver cancer as well. While Dr. Marco Antonio Valeros reiterated Department Advisory Number 5, Series of 2010, which highlights no pre to post-employment discrimination for hepatitis B patients. He said that status should not be disclosed, therefore it should not be strictly confidential, and the need for proper evaluation of the employees before declaring unfit. And of course, we have Sir Hilario Pahak and Mr. JP Moscoso, who shared bravely their personal experiences. And Mr. Pahak expressed for the continuous expansion of the viral hepatitis program. It has been 3 years since its implementation, and he believes that we can strengthen the program by building on our learning from its implementation. While Mr. Moscoso shared that those affected by hepatitis B often find themselves compelled to take on jobs that don't demand extensive medical qualifications as a pragmatic means to support themselves and their families. The discrimination not only affects personal well-being but also has a direct impact on the economic stability of individuals and their families. The second session, with Dr. Jen Agkawili Conde, wherein she shared her expertise on hepatitis, she mentioned that in the Philippines, the problem is the lack of accurate statistics regarding liver disease. For hepatitis B, a staggering 16.7% of adult Filipinos, or 1 out of 6 adult Filipinos, has hepatitis, which is quite high. As an update from the Department of Health, Sir Vincent Sumergido mentioned that there is an increased access for hepatitis B medicines, and he also highlighted the collaboration of different government agencies and stakeholders in addressing the elimination of viral hepatitis. He also said that the whole of nation, whole of society approach is the best way to approach this. In addition, Secretary Herbosa, in his message, said that chronic hepatitis infection, along with alcoholic and non-alcoholic fatty liver diseases, are the major factors of liver cancer. Based on the 2020 Adult Cancer Report, liver cancer is among the cancers with the highest morbidity and mortality in the Philippines, with a total of 10,594 new cases. He shared that for the next 5 years, the health sector is guided by the 8-point action agenda and with the aim to make universal healthcare a tangible reality for every Filipino, ensuring equitable access to quality and affordable healthcare and protection against financial risk. He also mentioned that the DOH has implemented strategies such as improving hepatitis B vaccination, expanding regular screening and early detection efforts, encouraging healthy lifestyle choices, managing needle stick injuries among health workers. But I hope these interventions will also be replicated to the general public. Ms. Annalisa Pastrana de Leon emphasized that primary care is important. She shared that PhilHealth shall provide primary care medicines, diagnostics, and laboratory and preventive, curative, and rehabilitative services. And I hope that each one of us who are participating here right now will also share this information to our families, friends, colleagues, and to everyone, so that everyone should be registered in the Consulta package. And lastly, Dr. Kiyo Izumi shared the regional statistics, of which that among the 354 million people with viral hepatitis B and C globally, 35% of which live in the Western Pacific region. He said that in the Philippines, we are doing a great job in terms of our regional value, and though there is still a need to take a broader action in terms of treatment and care, we are doing quite well. He also mentioned Mongolia's experience in eliminating viral hepatitis. And of course, we have this informative panel discussion and open forum, and there are a lot of takeaways that we can use later on and in the future discussions. And as a way forward, let me just reiterate a few of the strategic recommendations coming from the World Health Organization to support the elimination of viral hepatitis as a public health threat by 2030. First, the need to promote greater public and political awareness of the importance of prevention, testing, and treatment. It is also recommended to substantially increase treatment access by building on existing community and health facility-based services. Promote simplified service delivery models that include decentralizing testing and treatment to lower-level health facilities, including primary care. And moreover, the allocation of increased financial resources on prevention, testing, treatment as part of essential national health benefit package, which is accordingly addressed to PhilHealth, and the barriers faced by populations who are mostly affected and at risk should be addressed. And last but not the least, strengthen community and civil society engagement, including innovative partnerships. So to our distinguished speakers, guests, participants who both joined us physically or virtually, maraming salamat po and have a nice day to all.
And that concludes our morning roundtable discussion. Again, maraming salamat po sa lahat ng lumahok ngayong umaga. Let's give each other a round of applause, please. Okay. And also, we would like to thank our partners for their support, Roche and Gilead. Okay. Thank you also for continuously supporting our advocacies. So, before you go, we prepared lunch outside, so help yourself. We hope you enjoy the food. And last request, may we all have one big photo opportunity, just to show na we are all in this together against liver diseases. Okay? Akyat po tayo dito sa harap or sa taas. Dito na lang. Okay. Okay. O, sige. Sige, span na
Thank you, Joyce. Stand lang po tayo, tapos gawa po ng wide angle photo na lang. So, siguro yung speakers and panelists.
May we invite our speakers, our panelists to stay in front na lang po para magkakasama tayo dito. Si Dr. Jen Servants here, dito na lang po. Sino pa? Selfie daw. Si Shilo, tsaka si JP. And then, si Dr. Valeros and Dr. Bautista. All right, thank you very much po, and we hope to see you again in our next event. Have a good rest of the day po, everyone.